Hello, good morning, everyone. Welcome. Please take your seats. We'll be starting in 5 minutes as we have a packed program ahead of us. And before that, sit back and enjoy these next two videos.
In a world gripped by rising temperatures, we in Southeast Asia stand at the front line of this global crisis. We are experiencing more intense, more frequent, and more severe heat events, creating unprecedented conditions that are threatening our health, our lives, and our livelihoods. We have always lived with the heat and humidity, so it's easy to think we are used to it. But as the heat intensifies, we must ask, are we truly prepared for what lies ahead? Our countries, provinces and homes are feeling the strain of increasing oppressive heat, with schools closing, work disrupted, and heat-related illnesses on the rise. The toll of chronic heat stress is also quietly impacting our health, productivity and mental well-being. The region's rapid urbanization and aging populations, plus socio-economic disparities, further amplify the impacts, making this issue impossible to ignore. The time to act is now. This urgency has led to the creation of the Global Heat Health Information Network Southeast Asia Hub, a regional initiative of the global network which is spearheaded by the WHO-WMO Joint Office for Climate and Health. Anchored at the Heat Resilience and Performance Centre at the National University of Singapore's Yong Loo Lin School of Medicine, the hub will be central to the region's transformative action. Our mission: to foster collaboration, accelerate knowledge sharing, and catalyse evidence-based policy and action. By focusing on regional specific challenges and priorities to safeguard human health and well-being, we strive to prepare communities, protect populations, and empower individuals to thrive in a Southeast Asian climate.
Together as a region, this is our opportunity to build stronger, heat-resilient communities. For today, for tomorrow, and for future generations, let us commit to face these challenges head-on and build a heat-resilient Southeast Asia that can thrive in face of this warming world.
Together, let's rise above the heat.
พวกเรามาสู้กับความร้อนไป
Atudawa Apugo Choloaja.
Namin katahan melawan haba.
Cùng hợp thức phòng chống sốc nhiệt.
Daig natin ang init.
Bersama kita atasi rasa panas.
យើងរួមគ្នាយកឈ្នះបរិយាកាស
หุ่น
ឡើង
เห็น
ខ្លាំង
ก็สามารถเอาชนะอากาศร้อนเอาที่ท้าทาย
ตอนนี้ในความรู้สึกแม่เนาะอากาศสมัยนี้กับอากาศเมื่อที่ตั้งแต่แม่เฮ็ดนามา50 ปีแม่รู้สึกว่ามันเปลี่ยนไปว่าจ้ะ
เปลี่ยนจ้ะเป็นน้ำสภาพดินฟ้าอากาศจากตะกี้ฮ้อนอยู่แต่ว่าก็บ่ฮ้อนปานนี้เดี๋ยวนี้ฮ้อนอยู่บ่ได้ฮ้อนเสียงเลยเฮ็ดบ่ได้พอเด็กตะเว้นขึ้นมาแน่นี่แสบปวดแสบปวดฮ้อนเฮ็ดบ่ได้จ้ะประมาณ10 ปีแล้วเด้จ้ะหนาวกับบ่ค่อยหนาวปานใดเด้หนาวนี่ทลาบ่โดนเป็นหายใจบ่อิ่มแน่นหน้าอกแล้วก็เป็นหน้ามือเวียงๆประมาณเนี้ยเฮาต้องอยู่เฮาต้องเข้าห้องเป็นอยู่ห้องหม่องที่อากาศโล่งๆ
มันสิเป็นหน้ามืดครับตัวสั่นเฝ้าเข้าห่มซะก่อนแล้วก็กลับบ้านนอนก็เป็นบ่อยากหลับมันสิเป็นเพลียถ้ามื้อใดร้อนๆก็ต้องแปลงเวลาว่าถ้าเช้าประมาณ4 โมงสิพอก็หยุดแล้วตอนบ่ายมากก็ประมาณบ่าย2 ครึ่งก็ฮอด5 โมงแลง
แม่ก็สิเตรียมตัวออกไปแต่เช้าสิเตรียมน้ำแข็งไปน้ำเตรียมห่มไปพร้อมเพื่อว่าแดดร้อนมากเฮาก็สิเข้าห่มไปกินน้ำกลางห่ม แล้วบัดที่นี่ก็อันถุงมือจังซี่ก็ถอดออกถุงมือนี่ก็ถอดออกถุงเท้าถอดออกพยายามเฮ็ดให้อากาศถ่ายเทนะ
สบายขึ้น
สบายจากเฮ็ดหน้าอยู่แต่ว่าเฮาก็ไปหาเฮ็ดงานตัวอื่นอีกเพราะว่าสมัยซุมื้อเศรษฐกิจมันรัดตัวถ้าสิมาเฮ็ดแต่หน้าอย่างเดียวมันบ่พอกิน
So good morning once again. Welcome. Today we'll be talking about co-creating a strategy and framework to protect and prepare communities of Southeast Asia from the impacts of extreme heat. This side meeting is organized by the Global Heat Health Information Network, Southeast Asia Hub, in partnership with the Rockefeller Foundation and WHO Asia Pacific Center for Environment and Health in the Western Pacific region. My name is Dr. Janice Ho, Regional Hub Manager of the Southeast Asia Hub, and I will be your MC for this morning. We have a packed program ahead of us. In the first half of the morning, we will be framing the heat challenge and opportunities for heat governance in Southeast Asia, beginning with an opening keynote on the multifaceted impacts of heat, followed by a spotlight keynote on what is heat governance and using an overview of the extreme heat risk governance framework and toolkit. This will finish off with a moderated roundtable discussion to conceptualize the co-development of a regional strategy for heat governance and sustainable action. Then, in the second half of the morning, we will dive into two sectoral discussions on agriculture and children to further discuss the stressors and solutions of heat impacts in each area, and finishing off with closing reflections. And so without further ado, I am pleased to invite the first speaker to the front to provide the opening keynote. Associate Professor Jason Lee directs the Heat Resilience and Performance Center at the Yongloo Lin School of Medicine and National University of Singapore, where he also co-leads the Human Potential Translational Research Program and chairs the Global Heat Health Information Network Southeast Asia Hub. Jason, the floor is yours.
Good morning. Yeah, thanks for being here. I'm here just to set the scene, the stage here, because the main contents will follow immediately after me. First thing I want to say is knowledge is king, but context, we need a queen. So together, the policies, the recommendations, the guidelines will be more effective. Yeah, so the knowledge is important, but no point just knowing the knowledge, the what. I want to set the scene so you can apply the knowledge that you have from various organizations into the right context. Okay, so that's my first point. When I saw this a couple of years back, I thought it would boil for a year or two. But seems like it's never stopping. Every year we have new records. I don't know when this is going to stop. For us in this room, I don't think you will ever die of heat stroke. But your life can be compromised, as I will articulate. But as we come into this room, I want you to have the posture as we speak. Every second that passes, right? There are many who are struggling out there. So this is not an academic exercise. This is not one, no, we do this because it's part of our jobs, the papers we need to push out, policy paper, academic papers. But lives and livelihoods are at stake. Yeah, so I want you to come with a mind that is relaxed because that is best way to absorb information, but also come with a spirit of urgency because as we speak, many lives are being compromised. Just one technical slide. Yeah, I want you to go away, not assuming that a hot world will result in a hot humans, hot workers, hot children. And therefore, when the weather is not so hot, humans will not become hot. That is not true. This simple equation tells us, beside the weather, there are two other key inputs that result into hot: worker, child, attire, physiology of work, physiology of individual, the paying model of the work. All this will determine how hot the human being eventually will be. But this also presents opportunities in contexts where there's very hot. At times, it doesn't mean you have to stop. Is there scope for some manipulation on the attire? Can we incorporate more rest? Are there cooling strategies? Can we heat acclimatize them? Can we train them physically to increase their capacity? Yeah, so this brings about basic knowledge. It's not just about a hot weather, always resulting in a hot human being. There are other factors at play. Okay, this is the context. I often say we are frogs in the boiling pot. Analogies like such is common, and we are exactly in that stage where another analogy I've often used is this room that is very smelly, this room that is very noisy. Initially, when you enter it, you feel the effect. After a while, you get used to it. Such is the narrative for us in Southeast Asia. Singaporeans, Thais, Vietnamese, we complain about heat, largely as a discomfort. You know, when you complain means you feel the stressor. And what happens? If you have the power to change your behaviors, you would. So coming from Singapore, we hardly have anyone that die due to heat stroke. But we have many citizens, they are very good in avoiding the heat. And then we ask ourselves, why are we vitamin D deficient? What is there no such concept of commuting to work, cycling, or running? All our physical activity counts are all intentional. Almost that part that is incidental is non-existent. Yeah, so we are being compromised in other ways that you don't even are aware of. These are the implications of extreme heat, well documented. We call it implications tip of the iceberg. But there are other consequences there's less talk about. Yeah, so if you go about quantifying each of these, I hope you will conclude that the implications are huge. Some of the outcomes are not just direct heat exposure, it's because of it is getting so hot, so uncomfortable, you avoid the heat and induce new problems. I want you to see heat as a stressor. Since it is pretty much free for us in Southeast Asia, if you learn how to use the heat correctly, you can make the distress become eustress. If you exercise every morning half an hour, how about exercise 15 minutes just before lunchtime? Maybe the same cardiovascular strain will be induced because now you use the heat to work your heart. You don't have to exercise so long yet achieve the same effects. Talk about children, the parents are very worried with the warming world. Make sure you limit outdoor exposures. But in our context, you know, right, that our kids are not spending enough time outdoor. Bigger issues. But how about learning how to deal with the heat instead of saying that we should reduce physical education exposure? Maybe we can reduce the intensity if it's getting too hot, use the heat, shorten the duration, and therefore we don't have to go about complete avoidance. A couple of examples. It's not just about heat inducing injuries, death. It's not about productivity. Do you know our cognitive function? In this case, our risk-taking behavior can be affected when you are thermally uncomfortable. We studied a group of actual healthcare workers in a hospital in Singapore and found that when they were thermally uncomfortable, they began to take more risk. When the intervention in the form of ice slushy was introduced, the risk decreases accordingly. It means that when you're thermally uncomfortable, this machine that usually requires 10 steps, now you are a 10-year-old experienced worker, you might say that step 6 is probably redundant because it's unbearably hot. I want to get out of this hot room. And then accident can happen. You know, our body is quite robust. We can beat the heat. We do have physiological functions. We push the hot blood from the core onto the skin, and hopefully if there's a gradient, we'll dissipate heat. We sweat, and hopefully there's some gradient for sweat evaporation. We lose those heats. In most cases, we call it compensable. Here you see not an uncommon scene. A soldier in a passing out parade literally pass out. We call this heat syncope, vasodilation, like a blood flow, another drop. Usually they are fine.
I think the weather, then
But look at the photo on your right. Same physiology, but this case, he fell from height. Have we attributed heat was the cause? If not for the coroner who asked more questions, this would be attributed to a typical slip, trip, and falls at workplaces. My message is we have significantly under-quantified the implications of heat. You might go about thinking if there's no heat injury, means there is no problem. You can have other new problems due to thermal discomforts. May it be risk-taking, may it be heat syncope, in this case, falling from heights. So I want you to see heat in a different light. You can see it from a health pillar perspective. Unfortunately or fortunately, depending whether you know how to use heat, heat can affect how you sleep, exercise, and eat. You can look at it from a life stages perspective. You can look at it from a population specific. And today we'll be paying attention on 2 sectors, agriculture and our kids. These photos were taken when I was in Mahasarakam. I saw how the farmers work. They would think that with machines, robotics, it will relieve their strain. No. Whatever robots had took away that few hours, now they are doing additional jobs because for them, livelihood is key. So don't simplify the equation. Yeah? If I got robotics means they have 3 hours drinking tea and coffee. Many of these individuals are after livelihood. So if we don't secure their livelihood, don't bother about convincing them to invest in their health. How about our kids? In this case, not just children under heat stress. They were disabled kids. Have a look at population. They are really known to be compromised in thermal regulation. So here is the solutions. Yeah, we asked that Ali will give us a quick brief afterwards on Global Heat Health Information Network. I shall not elaborate, but more importantly, I talk about contextualizations. Yeah, here is a Southeast Asia hub. After this gathering, I hope there'll be more conversations to move this common agenda that we are all after. Many of you contributed to this. Thank you for being here this morning. I hope this will not be, as I say, just a meeting, but we'll use this to trigger more initiatives and be action-oriented. We are still in the midst of incorporating new members. Yeah, your organization's logos are here. We learn from behavioral experts say we need to co-develop the solutions, and therefore that is better ownership. So we are right in the midst of doing that. Okay, and also with that, I quickly set the scenes, and I want you to pay attention to the next few sessions on governance, who is the owner. On agriculture, it's not just about crops security. Without the farmers, there are no crops. On children, if they are our future, are we already compromising their health or potential? Maybe be learning in schools, creating a thermal comfy environment. So with that, with the posture, I conclude by saying, don't just do more. Do more just. I said again, not just do more just. Yeah. Heat in our context is just unveiling gaps already existing in our society. There's pushing out, reaching new thresholds. So this is a great opportunity for us to solve the roots of the problems. It might not be just heat per se, but it reveals gaps in our society. So don't just do more just. Thank you.
Thank you, Jason, for setting the scene for us. And now our next speaker will be sharing and providing an overview of the Extreme Heat Risk Governance Framework and Toolkit. Mr. Alejandro Sauze Raleigh leads the Technical Support Unit of Global Heat Health Information Network hosted at the World Meteorological Organization. He specializes in heat adaptation, policy and planning, and works at the interface of science, policy, and practice, managing grants that support regional and global heat health activities. Welcome, Ali.
Thank you, Janice, Jason, and the whole team. It's great to be back in the region, although first time in Thailand. So I'll try to be brief and to the point because today's pretty packed agenda. But let me begin with a little bit of framing also, just as we could see in the image, in the video. Society, humanity has been pumping too much CO2 into the atmosphere, and that has a direct consequence in global average temperature. But that is also shifting our climate. We are having more frequent, more extreme events, and that are also lasting for longer days. And this comes at a cost. We have certainty, we have evidence on the impacts that this is having in society in terms of morbidity, immortality, although it is underestimated, as Jason just pointed out. We know it's there. We know certain groups face higher risks, like the disabled children or outdoor or indoor exposed workers or pregnant women and others. But there's been action. Governments have been planning interventions. Heat action plans started a few decades ago, and several cities and countries now have an action plan in place. But, and there's a but, heat risk and heat management often falls through the cracks. Heat action plans have been usually led by the Public Health Authority. On occasions, it was the Disaster Management Authority, but mostly they've been led by one entity within the government. And this has obstaculized and in some cases even prevented the effectiveness of what was pursued in the plan. So before jumping into the heat governance piece, 2 lines about GHIN. So the Global Heat Health Information Network is a community of practitioners and specialists and institutions like the ones that you represent. We come together to work together on heat, to have a better understanding on what's going on, which are the specific mechanisms in which heat is affecting society. We have 3 main objectives. The first one is to bring people to the room, to the table, so it's convening and connecting people and institutions. The second one is accelerating the generation of knowledge, of actionable information that can be used to inform policy, and that's precisely our third objective. It's catalyzing policy and action at the local, national, or regional level. So we've been doing, in connection to Objective 1, a lot of talking. Is it working? The next one. Okay, thanks. So we've been talking to a lot of experts and practitioners that are working on the topic, and we've sort of identified and narrowed down to 6 main challenges around heat action. And I'll focus my attention in the last one, which is the lack of existing frameworks and policy mechanism for cross-sectoral coordination. And when we're talking about heat governance, we are precisely talking about this. How can we overcome this challenge? Yeah, next one. So throughout the last 2 to 3 years, we've been doing some research, some assessments on this topic, trying to understand what is actually preventing heat action plans from being more effective. And we've found 1 or 2 things that I'd like to share briefly with you. The first one is that there's a huge difference between having a governance coordination mechanism at a heat action plan than not having it. So whenever you or your institution or governments work on a plan that has to be cross-sectoral, if there's no coordination mechanism behind, there's a critical ingredient that is missing. Second one is to be truly cross-sectoral. We know that impacts are being subestimated. That's particularly in health, but also in other sectors. We know heat affects schooling, school attendance. We know it affects infrastructure, aside from productivity that it's going to be mentioned today. It has compounding effects because it triggers fires that then worsens air quality and so many other mechanisms that we have to make it cross-sectoral. So whenever we're working on heat action, let's make sure that we have representatives from many sectors, not just disaster or public health. And this is coming from research that we did last year. We did an assessment of heat action plans. And this, what I just mentioned, are some of the learnings. Also, that they have to be anchored in information, in local tailored information. And I'm talking about risk assessments, local vulnerability assessments as well. And we have this and some other pieces on the topic. So if you're interested, all this content is available in our website. So with all that knowledge and engaging with several partners, what we did was to understand that this is a new topic. It's an emerging challenge, and we wanted to work on a tool that could be helpful for authorities to move forward. So that's why we worked last year with UNDRR and many other partners to have such a piece. And I'll briefly mention that. But before that, a definition, because we're talking about heat governance, but we haven't defined it yet. So the definition we like, it's a process where actors, institutions, and assets across sectors, and again, this is the key word and the concept, are brought together to work on heat action. And that's guiding, coordinating, overseeing heat risk reduction efforts. And then the second clause of the definition can take many shapes, but it's critical that we are bringing people to the table, and that is as cross-sectoral as possible. Why cross-sectoral? Because it, again, has so many impacts in so many places that if we have a heat action plan that focuses on 1 or 2 sectors, then it's going to be falling short. And this is just to flag some of the impacts, definitely not everyone, but just to have a visualization of why it needs to be so cross-sectoral. And the other element I'd like to bring here, this is a different way of putting it, but the second element is that it's across time scales. In the assessment we did on heat action plans, the other element that we found is that the vast majority focuses on the immediate reaction. On occasions, these heat action plans are coordinated or led by disaster management authorities. So it makes sense that the focus is on the emergency response. And that's okay, but it's not sufficient, because what heat action efforts and heat governance efforts should also aim at is reducing vulnerability and exposure in the mid and long run. Are we also changing how our cities grow? Are we considering shading policies for the public space? Are we building building codes to reduce urban island effects and so many others? So also focus on the long run. Very briefly, the toolkit has and the framework has 3 different tools. The first one is a self-assessment. It's pretty simple, just a series of questions that help you understand like where your country or your local government is sitting. How is it? How well is it prepared in terms of heat governance? The second one highlights the components that are key to start operationalizing heat governance. And the third one is a toolkit to help have an effective heat planning effort. I'm just flying this by, and this is my last slide. So as a wrap up, let's remember that data and information are absolutely critical, and they need to feed heat action plan and heat governance processes. There's a lot of research on what actually works, what doesn't, where are the challenges, where are the gaps, and the information is out there. So let's try to avoid repeating the same mistakes. And the third one is on an MVP, a minimum viable product on heat governance also works. We don't have to aim for perfection from the day one. We just need to get the ball rolling. So focusing on good enough processes that can later on get perfected and be more complex, it's a very good start. I think my session won't have a Q&A, but I'll be around the full day and happy to engage with you all. With that, I think it's the last one. Thank you very much.
Thank you, Ali, for the informative presentation. We'll now move into a time of a moderated roundtable discussion, conceptualizing the co-development of a regional strategy for heat governance and sustainable action. Please welcome our moderator, Dr. Jaya Sridhar, a medical doctor and award-winning health journalist, WHO consultant, and until recently, senior health media advisor for Internews. Alongside her, please join me in welcoming the following panel speakers. Mr. Ponpom Wiketset, Chief Sustainability of Bangkok and advisor to the Governor of Bangkok. His diverse experience expands multiple sectors, including international affairs, academia, and politics. Dr. Benjamin Koh, Deputy Secretary of Sustainability at the Ministry of Sustainability and Environment Singapore, where he oversees national environmental and climate policies. And previous to this, he was overseeing health services at the Ministry of Health. Ms. Rachel Lee, Technical Officer of the WHO Asia Pacific Center for Environment and Health in the Western Pacific region, where she has worked closely with country teams, ministries, and partners to strengthen implementation of regional initiatives in climate change and health, school health, and non-communicable diseases management. And Ms. Alex Robinson, a public health professional and innovation specialist at the Rockefeller Foundation, where she currently leads a portfolio of projects driving cross-sectoral collaboration for heat health action. Jaya, please take it away. The floor is yours.
Thank you, Janice, and thank you also to the esteemed speakers who came before us, who've set the tone, I believe, very competently. It's lovely to see a packed room, and we have a considerable online audience as well, and we look forward to a great discussion this morning. We're going to try and keep it chatty and conversational and ideate together, so that's the idea. So welcome once again to our esteemed speakers, and I believe we have about 50 minutes. If someone could turn on that timer on the front row. Yes, that's the secret, huh? We're going to really get this conversation moving swiftly. We're going to explore what it means to move from fragmented responses to heat in this part of the world towards a more coordinated, collaborative, and effective response to these challenges. And we're going to be looking at what countries and sectors are doing, what's been missing, what needs to be done. And for that, we're joined by a really experienced panel of speakers. The focus is on the practical. That's really the aim of this conversation. So we can begin with maybe hearing the experiences of Bangkok and Singapore, who've both been deeply engaged in building heat resilience measures. And we're lucky to have two speakers here with us who've been on the front line of these efforts. So let's begin with hearing from Mr. Pompom Bikitseth, and then from Dr. Benjamin Ko, first on Bangkok, and then Singapore's experiences on how things unfolded, what led to the birth of the idea to build these measures, what were some of the key enablers, the key challenges, and most importantly, what transferable lessons can we take away that we can scale up across the region? So over to you, Mr. Pompom.
Thank you very much. Good morning, everyone. So I'm from the BMA, the Bangkok Metropolitan Administration. So I think, first of all, urban heat issue is a big issue for Bangkok. But because Bangkok is always hot, it's always been hot, some people kind of just overlooked that it is a problem. So they just feel like it's not really a health concern for them because they're used to it. But I think that first priority for us is to really communicate with the people that actually is a health concern for you. There are many risks involved. So we want to communicate about not just temperature, but also the heat index. So how temperature and humidity works together, that is a health concern for everyone. Because what we found out is not actually the vulnerable group that we typically associate with, the young, the elderly, that gets affected by heat stroke in Bangkok, but actually the healthy, but people who have to work outside. So construction workers, motorcycle taxis, we even have farmers in the eastern part of Bangkok, and healthy people who decide to go exercise in our public parks during midday. So these are the people who feel they are strong but have to be outside, and they are most at risk at heat stroke. So that's why we really need to communicate with everyone and to say that it's a health concern for you. So for Bangkok, we've fortunately have been supported by the World Bank Group in doing a big the heat index assessment. They have some important numbers saying if 1 degree increase in Bangkok, it will mean that there are 3.4 decrease in productivity, leading to 44 billion decrease in economic output per year, and they have to pay in billions of electricity costs in terms of the rise in heat as well. So a lot of economic factors for us involved. So the plan that we try to do is split into 3 things. So first is the place. So how do we make the city cooler? Increasing in trees, pocket parks, and also providing cool shaded areas, looking at how to paint the roof of our schools into paints that can be reflected, so white roof, cool roof policy. Second is the people. How do we notify the people in time? So in terms of emergency response, etc., and providing safety space for the people, turning our schools into cool rooms. So we have air-conditioned rooms in the school, and during the summer period, where it's the hottest, is where the school is closed for holidays. So we open the schools for public use as well. So when the heat index reaches certain levels, we open the schools for for nearby communities to use for free as well. We installed over 200 hydration points for people to have access to free water, and even talk to public buildings, for example, shopping malls, private buildings, shopping malls, hotels, etc., in the lobby area to provide free water for people to have access to. And the last one is on institution, to recognize that it's a problem that needs to be synergized between different departments, not just the BMA, but the national government as well, and to have a coherent plan so everyone knows who's doing what and what their roles are. So this is what we've been trying to do at the beginning. Thank you.
Thank you so much, Mr. Pompon. So it looked like dollars did get the effort moving, always helps to ease the wheels. Plus, we'd love to hear more on what kinds of leadership we saw to bring that collaboration about. But before that, let's go over to Dr. Benjamin Koh to hear about Singapore's experience.
Okay, good morning, everyone. I'm from the Ministry of Sustainability and the Environment. So like Bangkok, heat is not a new issue for Singapore. Our destiny is really tied to our geography. So we are 1 degree north of the equator. It is very hot in Singapore year-round. At least I think Bangkok, you may have some cool seasons. but Singapore, every day, the temperature is the same, 25 to 33 degrees Celsius. And there's no getting away from it. And I think besides being on the equator, we are also a very densely populated city. So the urban heat island effect is very real for us. So the challenge is it's acute and it's getting a lot more challenging. So there's a write-up on Singapore in the Extreme Heat Risk Governance Framework, which actually paints a rather rosy picture of how things are in Singapore. But actually the reality is a little bit more messy. So for many years, just like many parts of the world, I think, each agency would plan for its own heat response. So the infrastructure agencies would plan for its own how to deal with the urban heat island effect. The schools would plan for their own response to heat. It's only recently that actually we got our act together and started a lot more active coordination when the response to climate change actually became a lot more acute. Actually, we formed an interministerial committee for climate change that actually coordinates the whole of government response to the challenges from climate change, from heat, sea level rises, our own carbon budget, everything else, and it reports to the Deputy Prime Minister. So it's really a very high-level committee. And really to translate heat strategies actually into active planning and response to heat emergencies, we have an interagency team which comprises folks from many agencies: infrastructure, social, the economy, health, education, transport. If you are actively involved in managing any part of society, actually you ought to be involved in heat management. Now, again, there are many challenges that we face in planning for heat. I think one of the first challenges that is a trade-off between, I think Jason alluded to it just now, acclimatization versus thermal comfort. I think the more you try to remove acclimatization and just being in the aircon environment the whole day around, actually, I think you lose your resilience to heat. And this is something that we need to trade off very finely and not take away the resilience of our own populations to heat, even while we are providing measures for thermal comfort. Another big challenge for us is net zero. So being in an air-conditioned environment, obviously, I mean, there's thermal comfort, but there's also a carbon budget to it. So again, all this needs to be dealt with very finely, and whether or not we can explore solutions that are not so energy intensive, right? So these are things that we ought to think about, which we have been in Singapore. I think we talked about contextualization as well. Thermal comfort is dependent on many factors: temperature, humidity, wind speed. How do we then translate it into our communication to the public, right? And the public understands temperature. They may not always understand wet bulb temperatures or various other terms that we like to throw at them. So in Singapore, we have developed, or rather we have an interface on one of our apps by the Environment Agency. If you haven't seen it, I would suggest that maybe have a look at it. It's a heat stress level map that actually shows you the heat stress levels in Singapore based on a traffic light system. And there are advisories actually associated with each color in that sense. Well, I would say that social norms are also things that we need to think about. It's a bit surreal, being in Southeast Asia in a meeting and all of us are in jackets and ties. Yeah. It's something that in Singapore, I think we will try to move away from and encourage a more climate appropriate dressing in that sense. Right? But I wouldn't say all is doom and gloom. There are a lot of enablers, that we, in our own experience, we can tap on. So planning is one of them. I think we talked about urban planning. I think Singapore is pretty good at urban planning. So for the past decades, actually, we've been planning our townships to ensure that there are wind tunnels, adequate greenery, so to reduce the urban heat island effect. Again,
these are transferable lessons, but we can come back to that.
They are transferable lessons in a sense. But you need to think about it upfront.
Yeah.
Because once you build a town, it's very hard to shift the way you lay the town out.
Absolutely.
So you need.
Yeah. So one of the things that both of you identified at the start is really the focus on the vulnerabilities of people that are, under your purview, so to speak. So I'm going to quickly move to Rachel now, and with your intense and considerable experience working with frontline populations who are in the midst of the heat crisis, what would you say are some of the key interventions and lessons learned, and what should we be looking at in terms of priority actions that can be scaled across the region? We'll come back to our speakers.
Thank you. I was hoping our colleague here would be here and start conversation about what they've been doing with actually community members in the heat work. But really just my first thought actually in thinking about this question was about vulnerable populations to start with. And I don't want to take the kind of conversation away too much from the practicalities, but sometimes, the title of our session is thinking about co-developing a strategy, a framework. And so it did get me thinking a bit about like the kind of wording and the language that we use. And so one thing that kind of dawned on me right away was this idea of populations in vulnerable situations. And I have to credit our colleagues over at PAHO and AMRO in our Americas regional office. And they've been very big proponents of using intentional language around populations in vulnerable situations and rather than vulnerable populations, and big proponents in health equity, which I think heat and health is such a big, this is what it's about. And so thinking about kind of shifting that language, because I think Jason's mentioned it so well, this importance of context, and we're talking about localized vulnerabilities and all these things. So that's the first thought I had, as vulnerabilities are, they're constantly changing, they're never static. And when I think vulnerable populations, sometimes there's this, there's power in language. And so thinking about not these vulnerabilities being inherent to people, but rather there are the situations, and that's literally what heat and health is about. Like exposure isn't vulnerability. And so how do we think as we move forward with this strategy and working with communities that they're not inherent, and sometimes also shifting the language from like community versus us, like practitioner versus community, I think will be a big part of the strategy as well. Like we are part of communities as well, and how do we also build community around us to deal with heat and heat stress? So I think a lot of the solutions that we need to scale up are really community based, and so how do we not kind of dichotomize ourselves as practitioners and then also community members, and of course, without kind of taking away the privilege that comes with being public health practitioners or doctors or policymakers, of course. So that's just one immediate thought I had. And we were thinking about what interventions in terms of scaling up for communities. And of course, coming more from the WHO side, the health sector side, because I'm relatively more new to this heat and health space than a lot of you in this room, to be quite frank. But bringing some of the other lessons from the work I've done with WHO, really thinking about what we're good at, the kind of institutional positioning, so that our efforts are effective and not wasted, and so that we're prioritizing what we are doing. And so we've been thinking a lot about capacity building within the health sector. So even the kind of reframing that I mentioned, you know, what if someone comes in for heat injury treatment, like how do we make sure that we don't send people back to the exact same context that they came from, that they were vulnerable in? And so I think that's one thing we've been thinking a lot, because there are really regular touch points in the community, right? Healthcare workers, healthcare volunteers, health volunteers at the community level. So health promotion will be a big part also of it. And so health sector, that's one thing. And so final, thought, in the health sector, the work that we've been already trying to accelerate, so around climate resilient and environmentally sustainable healthcare facilities. So how do we incorporate like the work that we're already progressing to reach communities? So the kind of low cost interventions like the heat reflective roofs and whatnot that we can do in the health sector, that's something we've been thinking about a lot. And the vulnerability assessments, because most often I feel that healthcare workers know their communities well, and who's placed and who is going to be most vulnerable. And so recognizing that and involving them in these conversations, because ultimately I think we're all saying that in terms of governance and getting more buy-in, we need that information. And so I think that's something we're thinking about, how to involve the health sector and the workers on the front lines to be really involved in speaking to community and ensuring their voices are captured. So those are our initial thoughts. I'll pass it back to you.
Thanks, Rachel. So again, it's all coming back to some of the age-old lessons we've learned from public health over many, many decades, which is community-fronted, community-led initiatives and, spreading the ownership across a wider group so that the burden is shared, and then there's greater democratization and participation and learnings that can be exchanged. And that's what the aim of this panel is. But just to hit a slightly more concrete note on moving from, yes, this is ideal, but here's a compelling case for investment. And how can we mobilize resources and increase sustainability on heat governance and related projects? So what's worked, Alex, and what needs to change?
Yes, absolutely. And hopefully you'll hear some of the themes that my other panelists have already brought up in this case example. But I think the investment logic for heat is unusually strong when we think about other climate hazards. You know, extreme heat is predictable days to weeks in advance, which means governments can act early. So they can retime their existing health, agriculture, and social protection spending rather than having to pay later for avoidable hospitalizations, for productivity losses, and for deaths. And we know that heat is already the deadliest climate hazard globally, but it remains underfunded precisely because it cuts across sectors. So who owns this? And that makes governance, and you know what we're here to speak about today, the highest return investment, we believe, for countries. And so an example of where this is working, I'll turn a little bit outside of the region to Bangladesh, where we've seen prolonged heat waves are already eroding livelihoods and health there. So in 2024 alone, with a historic heat wave, there was an estimated 250 million work days that were lost in the country due to heat. And while weather data does exist in the country, there's no system to really translate heat forecast into decisions that can affect most vulnerable populations. And so Heat Shield is a new project that RF has supported. It's led by ICDDRB in partnership with many ministries, and it's designed to fix that governance gap that exists in the country. So instead of building a parallel system, the project is really investing in integration. So it's strengthening, we're using kind of the agricultural department as the inroad to broader engagement, but it's strengthening the national agricultural meteorological platform with color-coded heat warnings, heat health warnings, very localized advisories and population-specific advisories, and then an AI-enabled chatbot that's been co-designed with end users like farmers and community health workers. And so I think just as importantly here, health is fully embedded in the co-creation process. And so the Ministry of Health has been brought on board as part of a national technical working group that's been stood up. And we're working now on operationalizing heat-related illness guidelines, and health workers are being trained using nationally endorsed protocols. And facility preparedness in pilot sites is being assessed upfront so that the system can actually anticipate rather than respond to crises and heat crises. And the team is working with agricultural extension officers, already trusted partners of farmers as this vulnerable population in question, and they're trained as heat risk messengers. So they're actually linking the climate science to the behavior change and hopefully health protection being realized and livelihood protection on the ground. So I think the payoff for the investment here is really durability. By working through the ministries, working through national platforms that exist, and working through the workforce, our hope is that Heat Shield will lower the longer term operating costs, really build institutional ownership, and then create a model that the government already has an appetite to scale nationally. So I think the broader lesson for South and Southeast Asia is that heat governance works when investors fund integration and not silos. So climate science linked to sector systems, that anticipatory action embedded in routine practice, and then coordination across many ministries. And so I think we're seeing that when done right, these investments can really deliver the triple dividends that we all hope for. So avoided health costs in the long term, protected livelihoods, and stronger institutional resilience.
Really leads to the next section on this panel. And I think you've set the tone very nicely around heat governance, like who should be in the room, what kinds of leadership do we need, what kinds of collaboration needs to happen, and what is that magic spark that got people together? Who convinced them, and who doesn't allow the momentum to slip away? So maybe, since Alex, you're on a roll with this, let me come back to you for just it's just going to be 2 minutes per speaker on these thoughts, but what happened in Bangladesh that hasn't yet happened across the region?
Yeah, I think what happened was starting at the local level and then seeing how it can be effectively kind of scaled up with layers of institutional accountability. So, we are seeing in that context heat governance really working best when leadership first sits and is embedded where the impacts are acutely felt. And so then layering on coordination that enables national and regional engagement. So I think at the local level, we need to see leadership resting with municipal governments and frontline systems. So in the Bangladesh example, Heat Shield actually engages and treats community health workers, agricultural extension officers, and other key players on the ground as a part of the governance system. So they're not kind of an end user of this system that's created without them. They're trained, they're equipped, they're actually linked and integrated with the early warning system so they can act on the front lines before the impacts of extreme heat escalate. And then I think at the national level, what really works is thinking that heat needs an institutional home, but not a single sector owner. And so in Bangladesh, we see that each ministry is kind of taking a role. They're held accountable to a national set of guidelines. They're co-creating and sharing in the early warning system. We're also seeing this work really well in Nepal, as the Disaster Management Authority is leading on developing a heat anticipatory action framework, but all other ministries are at the table to co-own the triggers and thresholds that are set, and then the response protocols that are being enacted. So I think multi-sector coordination, when we think about it, really in the Bangladesh context was enabled through national technical working group that forces alignment and co-ownership.
Very quick last question to you, like how long has it been? Just a one-word answer. How long has it taken for this momentum to build?
So really the momentum has exponentially built in the last year, and we're moving into this heat season now, kind of prepared and ready with baseline assessments of facility readiness and training underway for farmers, and then kind of activating. But I think it's been years in the making with a recognition on the part of government that the need is both acute and chronic, and 2024 heat wave was really a compelling impetus for investment moving forward.
Thanks, Alex. And I think that's we'd love to hear from both Bangkok as well as Singapore. Like, what are the parallels and similarities, and what kinds of leadership was required to get your heat resilience measures on the ground and running? And what are some of the lessons that we can take away? Maybe Mr. Pomhon?
Yeah, so for Bangkok, you see we're a municipality level, but actually Bangkok is divided into 50 different districts as well, where the Bangkok city government kind of oversee it all. So I think we try to decentralize as much as we can on all the issues, including health and heat issues as well. So we really try to get all the district offices to be as close to the people in terms of giving them information and going to see where is the real risk spots. For example, where is the low-income communities, where there is the lacking of air condition, where they use metal sheets as their roof, where it really generates even more heat, etc. So we try to decentralize the work there. But actually, on the city level, we have to have a big master plan on how to at least attempt to reduce the temperature of the city, because we want to be like Singapore, city in a garden, right? Yeah, so we really prioritize greening the space, as we see planting a lot of trees, and you see on the BTS lines, you see a lot of trees wrapped around. So how to make the gray into the green. So that's on the city level that we try to do, or trying to make more green spaces, which is not easy for Bangkok because there are not a lot of space left, especially in the city center. So we really have to be creative in finding the green areas. For example, sharing some space with the temples, asking, because we have a lot of temples in the city, asking for them to turn half of their car parks into green space, compromising with them, or areas under the expressway, etc. So at the city level, we really need to push the issues as well. But on the national level, we also have to coordinate as well, because in the past, there's a lot of work has been done in silos. So the health ministry, they do a lot of work on health, heat-related stuff, but sometimes lack coordination between them and the city level. So we try to have the heat committee, which is the first time we established it 2 years ago, and to bring all the ministries involved. Also, the disaster response department under the Ministry of Interior, who have the technology of cell broadcasting to send the message out to the people in real time in case of emergency. We have done it for PM 2.5, and now we're adding the heat concerns into the cell broadcast protocol as well. So a lot of departments doing a lot of things on heat, is doing differently. I think at the Bangkok level, we try to bring them all together on the table. And I hope that in the future, at the national level, there is a heat committee as well. Because if we compare the issues to PM 2.5, a lot of governance work already been done and completed. So a national committee on PM 2.5, and everyone knows what they're doing. But I think heat, we're not as far as that, but we're getting there. So I think on the governance issue is very important that everyone have a clear identified role.
Thanks so much. And Dr. Benjamin?
Okay, thank you so much. I think Singapore perhaps is a little bit different from many other countries because we are a small city-state, so we only have one level of government. So I think it simplifies things for us, but again, please view it in that context. So I had talked a little bit about how Singapore organizes its heat response. There's the Interministerial Committee for Climate Change. And again, there's a heat committee, which deals with the day-to-day issues regarding planning and response to heat. I just want to perhaps make 3 points on the importance of governance and how to make it work. I think firstly, you will need someone high up enough to pay attention to the issue and ensure accountability, right? So in our instance, it's really the Deputy Prime Minister who chairs the Interministerial Committee for Climate Change. And actually the agencies all have to report into that committee, whether it's a response to sea level rise or carbon by heat as well. I think secondly, you need someone to own up and own the issue. When things are co-owned, actually nobody owns it. And I think it's a little bit difficult. It's not to say that the process certainly should be inter-ministry, inter-agency, multi-sectoral, but someone needs to own up and say, okay, fine, I will take charge. And in this instance in Singapore, I think it's the Ministry of Sustainability and Environment. And I think I co-chair the HEAT committee with someone else, but it is how I guess we figure things would work best in that sense. And finally, I would say that actually it's very important, easy to say, okay, let's government, we plan everything, but I think it's also equally important to mobilize the whole society to deal with heat. I think communities need to be empowered, in how to respond to heat, and we need to give them enough information to make those right decisions. Because it's very difficult for, an agency to go out and say, oh, you shouldn't run at this time of day, but it's easier if you empower them, give them the information, and say the heat stress at this time of day is green, so yeah, you can go run, yeah, or it's red, and please don't, yeah. Businesses as well have a part to play, because I think, construction, transport, I think these are businesses that actually are relatively sensitive to heat, and their workers are actually exposed to the elements in that sense. But even those who are, sitting in offices, that I mentioned just now, attire and things like that, I think businesses do need to start thinking about the impact of heat on their business model. So these are the 3 points that I want to make.
Thank you, Dr. Benjamin. So it seemed that I'm going to quickly interrupt to ask us all to welcome Lieutenant General Nat Bali from the Thai Red Cross, and looking forward to hearing from you, sir. But I just wanted to round off this part of the discussion by saying that it looks like a lot of the human resources that are needed, the experiences that are already there, and the tools that are essential to build an effective heat resilience plan are hiding in plain sight. It's just that they haven't really come together in several of the countries of the region. So huge argument and a case there for better sharing of experiences across the region with the help of the media maybe, as well as more, sort of a structured response with intergovernmental meetings. Lots of things need to happen. But I'm going to quickly invite General Bali to sort of share your thoughts on the disproportionate impacts of heat on populations in situations of vulnerability, and your work in that area. What do you think needs to be prioritized?
Thank you for inviting me to join this meeting. As a NGO, non-government health humanitarian organization, that we have a hard work to work on this issue. Actually, we take it so lightly in the Thai Red Cross Society. But since I were working in the army before, and we have care about the heat, especially on the exercise of the private military men, and sometimes before we know about the heat stroke, and we command to have the trainer to aware of this subject very much, that so they don't have to exercise for the private military men between 10 to 14 hours in the morning, in the afternoon. But come back to the heat for the general public. We so aware of this but we don't care much in terms of vulnerable group, for the aging people and for the disabled, and also other that vulnerable group in the society. Anyway, since we have meeting in the last week at the UN Ocean, and we should be made aware of this for the local government, that we have to act on it, especially in the Bangkok itself, and we have a lot of not only heat, but also the PM 2.5 as well. And talking about the local government actors, we have the village so-called sub-district health hospital, and this one we can talk to the local people that they should aware of the heat, because affect the aging people in the society very much. And since we are in the age society at this point, so we have to figure it out. Actually, village health volunteer, they are aware of all other subject for the disease, but we have to push forward to have them to aware of the heat that may affect the health of the aging people as well. And for the outside, I talked about the Department of Defense already, but for Thai Red Cross ourselves, we have volunteer about 400,000 people volunteer in the Red Cross Society, but we have about 40,000 active in this field. We, Thai Red Cross, we work for the disaster, so-called community-based disaster risk reduction, and we work with the community very much, and we can push the knowledge for our volunteer to act on this subject as well. And we work very close with the DDPM and Department of Disaster Prevention and Mitigation of Ministry of Interior. And so we have to work together on this risk reduction for this subject as well. Thai Red Cross, we have health station, 14 health stations on my bureau. And this one, we have to put this issue on the front page as well. This one we can do at this point. Thank you very much for invite us to comment on this subject. Thank you.
Thank you so much, General Bali. We just heard from Jin and from Alejandro on the global framework. And so my question to all of the panel speakers, maybe moving from Mr. Pong Pong all the way down the line. Sorry to make it a round robin, but how can we move forward with implementation initiatives to get the framework going in this part of the world? And what are some of the key guiding principles and priorities to keep in mind as we try to co-develop a regional strategy and framework?
Well, yeah, as I said in my first point, I think have to communicate to the public that this is a problem now that needs to be tackled. And then to have an action plan that people can see and all stakeholders know what they're doing. And then for us, we want to have a short-term plan and then also a long-term plan. So short-term, in terms of health, identifying the risk hotspots, and then how do we can help them in terms of like finding, like as I mentioned, like cool stations where bad days people can use to relax and get away from the heat, increase hydration. This is the thing that we can do straight away, use some of our budget and invest right away, or even painting some of the roof white in terms of helping with the reflection. But the longer term, the decrease in temperature is harder work, increasing green space, etc., and communication. One thing we really want to focus on is education as well. So how to get the young to realize this issue. So we did something very low cost, but very effective for PM 2.5, which every school under the BMA jurisdiction, so 437 schools, we invested very cheaply on a flag system. So every day the kids go to school and check the AQI. And if it's yellow, so not such a good PM day, they plant the flag yellow. If it's a good day, then plant blue or green flags. So once we have that system in place for the heat season, we just did the same thing. So every day they go and check the heat index and then plant the flags of colors accordingly. So both the kids and even the parents who come and send them kids already know about it. And then once they know if it's orange, how do they have to act? So they go and read and say, okay, they shouldn't go outdoors, exercise outdoors, or precaution, etc. So I think to have a short and longer term plan is a framework that we want to do. And in terms of the global, I think for us as a city, we appreciate having learning exchanges with other cities who have done good work in terms of the heat issue. So for example, we learn a lot from even the Phoenix state government, I think, which is helped arranged by some international organizations because they did a good network of cooling rooms. So we learned from them what are the standards for the cooling room, what is their definition. So learning a lot from what other cities or states, etc., are doing, and then trying to replicate in our own local context. So.
Thank you so much. I think lots of practical pointers as well as ways to move forward. I couldn't help thinking about the overall umbrella theme of this whole conference, which is navigating demographic transition. But it's not just demographic transition that we're navigating in this part of the world or in other parts of the world. It's a whole lot of other things that are in flux at the moment. So I was wondering if building a Southeast Asia collaborative network to frame and jointly develop a governance framework for heat governance. What else needs to happen besides sharing positive case studies or those sorts of exchanges? Dr. Ko.
I read the global framework document again last night just to refresh myself. It's actually a very good document, I must say. Yeah, very comprehensive, step by step. I think one key thing about the global framework is the robustness of the climate science. The response needs to be tied to data. So in Singapore, our climate Center for Climate Research actually has downsized the global climate models into a lot smaller resolutions for Southeast Asia, 8 kilometers for Southeast Asia, and even finer 2 kilometers for Singapore, all the way to the year 2100. We'll be very happy to share the information. In fact, some of the information is already available in the public domain. So if you need the data to try to guide your climate change, actually, we have done some work. It may not be the fully authoritative work on it, but at least it's a start. Be happy to share that. So that's my first point, that actually it has to be underpinned by climate science. The other is, I think in Southeast Asia, capability building is one thing to perhaps read and share examples, but I really do think we need capability building. And Singapore also probably, I wouldn't say that we are fully equipped to deal with the challenges of heat, but we are trying to equip ourselves, our research institutions. I mean, we have Jason, we have other researchers in Singapore doing research on heat, but even our own government officials, I think we are trying to equip ourselves with the ability to plan ahead and deal with it. And we are really quite happy to share that information and share that experience. So these are my 2 points.
It looks like we need a more structured way to create platforms where these experiences can be shared and try to see how we can prioritize those structures and timetable it, have a calendar moving forward. But over to you, generally on the same question. How can we work better together?
Yes, I think this is very challenge for the human being in this world, especially the development. And we develop for high-rise building and less park, less tree. That's the human being, they try to make sky high. And I just wonder, it is a contrast to what we are talking about, the heat. Actually, in the building forest, what you call the high-rise building, this block the wave of the wind to go through. This is a very basic thing, for the inner city or the big city. That's something we should care about in terms of public organization or public authority. Should each building that rise up, can we have the park or the tree to leverage this structure or whatnot? That's challenging. For the outside to the country, we didn't have much problem, except we have to give care-based, knowledge-based for those public awareness of the heat. Since we are in a tropical country, sometimes we quite lenient or adapt to the heat so much, especially in the Asia Pacific people. So more or less, they don't care much about the heat. But anyway, if we put this one in there, some mindset that, hey, not take it easy. Sometimes it happens to the aging and the vulnerable group very much. So we have to put the care base on this. So they get the attitude toward the heat so well until they get the skill how to prevent and to aware and to work on this subject very well. and then they get a good habit to work with the heat in the future as well. So I put the word so-called CASH, K as a knowledge base, and A, attitude toward the heat, and then S, the skill or to work toward this very well. And finally, they get a habit to work with the heat. So this in CASH base, who will do the job for this? Many ministry concern, not only the Ministry of Interior, but also the Ministry of Defense. I talked already, but Ministry of Agriculture and Cooperation, they have to work on the tree growing and that stuff, as well as the Ministry of Labor. Sometimes they're working in the factory, and we didn't care much about the worker in that close situation, and we have to make them aware that, hey, this one is your subject as well. So thank you very much.
And so, Rachel, back to a more regional perspective, like how do we bring players in the region together to sort of explore the global heat response framework in a meaningful way? Who needs to be at the table? What are the steps moving forward?
Yeah, I was thinking a lot about our region. And yeah, I mean, to give you all some context, like Western Pacific region in the area that I work in, it's 38 countries and areas, and a lot of places that are so hard hit with climate change impacts. And I would have to say one of the, like, if you look at the great resource from JIN, the Heat Health Action Plan resources, many are missing from our region, to be quite honest. So there's a huge gap and big need to work in this area. And so thinking about coordination mechanisms and moving forward, I think we need to address the issue of buy-in and political will and everything, and everyone's Dr. Ko has also mentioned, how do we do that? I think taking actions forward, thinking about like practical mechanisms. Sometimes narratives like stories sometimes are like the most efficient ways to hit home. I mean, we've seen the videos. I think that really hits home and getting people aware and to advocate for heat health coordination to begin with, within public as well as policymakers. So that's one thing. But then also, of course, complementing that with numbers, with the data, of course, from the health sector side, the health data that comes with the climate data, and putting that together and being able to show the impact. I think that will be really key to even put that on the map, because yeah, there are areas and countries in our region that are dealing with sea level rise and typhoons at one after another, and so sometimes I think he tends to take the back seat, and so trying to get it's a difficult task to get the health data beyond mortality, and then trying to capture the broader impacts of heat that Jason has started to mention, like all of these different dimensions that heat can impact our lives and result in negative health consequences. So that's one in terms of like practical mechanisms. And then I also just want to touch back on Alejandro's point about MVPs. Like I think in our region, people have taken this huge undertakings to develop NDCs and adaptation plans and these mechanisms. And I'm kind of thinking about lessons from public health on vertical programming, and like, do we want to approach this in the same way? Probably not. There have been great mechanisms to bring people together, whether it's disaster management agencies or doing these very difficult and complex tasks of bringing people together to create a national adaptation plan. Can we use those existing processes and make sure that heat is placed on the agenda, and use these intersectoral, interdisciplinary mechanisms? I think is one maybe a practical way forward. Can we start there?
Learning from COVID, for instance.
Exactly. Yeah.
Learning from the response to HIV, for instance. And I think we have about 1.5 minutes left. I'm going to give it to Alex to sort of round this off. If you had to say that there had to be that one precipitating element that can get a regional response strategy conversation going in a meaningful way, what might that be?
I would say framing, when we think about the global framework, I think framing this framework as something that we're not trying to import. It's something that should be designed to be localized and operationalized through systems that exist. So I think starting there and basing conversation in that. And I think the most practical starting point for kind of launching this regional engagement around the framework is to establish a shared baseline. And I know Alice, touched on this a little bit, but thinking through how we can assess governance maturity, identify gaps collectively, and agree on common principles for thresholds, early warnings, and heat action planning, and then starting from that common base, and then kind of individualizing and contextualizing from there. And I think as a rallying cry, leveraging existing bodies such as GIN that are there and being stood up and regionally and facilitating cross-regional exchange based on maturity model and learning.
Thinking of things like ASEAN and existing frameworks that could provide diplomatic channels that could bring this together relatively quickly, because I think no one can ignore heat stress anymore. It's in our faces. But I think we've done great on time. I'm very grateful to the panelists because you've been so swift and pointed with your comments. And the floor is now open for questions. Please keep them short. Direct them to specific panelists, and we have about 15 minutes. And we'll be taking questions from the room as well as from our online audience. So it's now over to you. Yes, please. If you could come up to the mic because they're recording this. You identify yourself and yeah, thank you.
Hi, everyone. Good morning. I'm Pamod, representing DHIS2 and the University of Oslo. So first of all, a big thank you to the panel, excellent panel. It was very informative. I have a question. I don't know to whom I should be asking, but for the entire panel maybe. Coming from a data background or information background, again, in the panel, it was highlighted over and over again, the importance of having a decentralized action where decisions are taken not only at the national level, but at subnational level. I mean, main challenge which I have seen in the countries, and the question for you is like, what are the challenges about data? I mean, the access and sharing of data in the first place before you actually make any data use and related interventions. So what are the challenges you see in sharing this data and making this data available at subnational level for this kind of action in countries in the region? Thank you.
Anyone who would like to go first? Or if anyone else has a data-related question, can we tag that on? Okay.
May I? Okay. Actually, we talk about the data. As I looking into, I used to be work for the government before in the military, but we have so many stakeholders that hold the data or information about this. And the big problem is everyone hold their own data. They didn't share for each other. That's a big problem for the, I didn't blame on the civic servant or public authority, but their mindset. Now, who will be the, top level that can share the data or knowledge on this? It's a big problem of the public sector. Now, whether the highest ranking public servant or public authority, they're aware of this, and whether they can tell the people who have the data on this heat problem to share for other stakeholders, as I mentioned before, many ministries that we're talking about. And each ministry, they have their own action plan to cope with the heat situation. That's only way. Otherwise, they won't share. Since I mentioned before, we are in a tropical country. We're not like in a Western country that when they have only 22 degrees of centigrade, they get heat, and some people die from the heat on that subject. But for our countries in this region, Southeast Asia or Asia Pacific, and we didn't care much about heat. That's a big problem. As well as the public authority, they didn't care much about heat either, because they sit in the air-conditioned room all the time. Thank you so much.
Thank you, General Bali. But I wondered if anyone wanted to comment on how we can better collect and share data. I mean, we've heard a lot of talk about dashboards, but what are the barriers? What are the enablers? What needs to happen?
I think in Singapore, we don't really have a problem with sharing heat-related data.
With other countries?
It's out in the open. It's out in the public domain. I shared about the app just now. I mean, data collected by governments out there. I think the real challenge will come when, because of the miniaturization of a lot of these sensors, actually your phone could be in future, could be collecting data. So like traffic, how do you democratize this data such that we have real-time heat data that people can react to and use? So I think that's something that we may need to think about in the future.
Great point. And maybe we'll take an online question and the in-person question together. Janice, over to you.
Yes, there are quite a lot of online questions, but maybe we'll choose a couple. One question was on unplanned areas and those living in informal housing with poor ventilation. How do we integrate these unplanned areas into citywide heat action plans without a threat of displacement?
Well, this goes back to the data, and I agree with the general about the hoarding of the data, which is a real thing. I'm Alvin Marcelo from the Asia eHealth Information Network, and our vision is an interoperable health information network. And I think what's really missing right now is a clear governance framework for people to trust each other. Just asking for the data for data's sake might not really work. But if you first pose the problem, like heat, and then give the people an opportunity to converge and try to solve this problem together, they might be more willing to put up their data and make it interoperable. Thank you.
Would anyone like to respond to that as well as to the online question about unplanned areas in cities and maybe elsewhere that are falling through the cracks of heat governance?
Again, I would like to mention about this, whether this heat subject is in the national agenda or whatnot. If it's not national agenda, who care? That's only one point. If we get mindset together, this, hey, look, this a heat subject is one of the most vulnerable subject in your country and or in the region, that they should make aware and get to know this one so well and act on it. That's it. But if you take, like I mentioned before, if you take so easy, take too lenient for this subject, no one care about it. Thank you.
Thank you, General Bali. And maybe the question on the dark areas that are falling between the cracks of heat governance. May I ask Mr. Pompen and then Dr. Benjamin to respond, and anyone else has thoughts as well.
Yeah, so I think like many big cities, there are unplanned areas, the low-income communities, but this is, I think for me, more than just the heat problem. It's more about quality of life, because they're not living in, they're living in below standard, way of living. But if you ask them if they want to move, if they want to live in a better area, but a bit further out, they don't want to. They want to live because it's closer to work. So I think it's a very, very social problem that we have to tackle from all angles, not just, you have to move because 1, 2, 3, 4. So have to be very delicate. So that's why we need to decentralize, because the local district level governments, they understand these problems much more than even the Bangkok level or even the national. They wouldn't understand all these delicate problems. So I think we have to pay attention to this a lot. But how we can in the longer term generate some interest for them to move. For example, create a satellite city where work and new living spaces are near to each other, so they don't feel like they have to go and live other areas and then come and work in the same place. Or it's more of a macro management on the city level. But if you say that, oh, this is a low-income area and you're related to heat stress and your solution is to just move them, this is a very big social issue that cannot be overcome overnight.
I think it's a little bit difficult for me to answer this question. I think in Singapore, I would like to think that we do not have unplanned areas. In fact, we are probably guilty of over planning. So that's the Singaporean DNA. Yeah. I thought the question, perhaps in a more general sense, relates to how we deal with vulnerable populations. So that there's a presumption that people living in unplanned areas, or perhaps hearing from the panel, low-income groups are more susceptible to heat and the effects of heat. But I think maybe we ought to take a step back and look at the evidence. What does it suggest? Right, that there are other communities that we also do need to look out for. The elderly, for example, they are more susceptible to the effects of heat. Pediatric populations, which we will talk about later. So I think in our focus on looking after vulnerable groups, I think what we have done and we will do is, of course, people living in perhaps housing that may not have adequate ventilation. Obviously, they will be a vulnerable group as well, but we should really look at what the evidence says and really target those populations and help them, take care of themselves.
Essentially unplanned areas like inner city settlements, lots of rural to urban migration, which are creating these disproportionate impacts on the residents. So unless Alex or Rachel have very short comments to add, we can move to another question.
Yeah, maybe super briefly, like I think the question, we can't give it enough time to do it justice. For example, I mean, it is much bigger of a social problem, but just thinking very briefly, as we move forward into the future, then practically, how do we not change situations of vulnerability? So when we're planning and cities are getting bigger, how do we then incorporate heat into that? Like I'm thinking more about that, what we can do, making sure that it's planned, making sure climate and heat specifically is incorporated into the planning. The rapid urbanization is still ongoing in many of our cities in the region. I think in our region, there's I think top 6 cities in the world are in place, still growing. And so how do we do that? And as mentioned, the situations of vulnerability change. Like if there is a new development coming up and trees are being cut down for that, okay, how do we, and I think that's where I'm thinking in the future, practical steps, let's incorporate heat. And sorry, online question for the participant for not being able to do it justice, to this question, but I'm thinking practically in the future.
Yeah, I think we have a bunch of questions. I'm going to come back to Alex later, but I mean, governance. Maybe we need firmer rules and governance on urban-rural migration. I don't know how that's going to work. Are there going to be more stringent measures in place that are going to govern that whole process, putting in mind human safety as a premium and using that as a logic and a rationale to arrive at a very diplomatic solution? But back to you, Janice.
Actually, that question is right on the ball. So online, there are questions on what is the biggest challenge in effectively responding to rising heat risk in Southeast Asia, and how can countries coordinate across ministries on this issue, and will the heat governance framework for the region be different for different cities, or how do you guys envision that happening?
Anyone? Maybe. Oh,
and a question from the floor.
Sorry, I didn't see.
Thank you. My name is Xiaoyan Chen. I'm the country office director from ILO, cover Thailand, Cambodia, and Laos PDR. So this is a very interesting, but also the urgent topic we are discussing here. For me, it's not a question, but a proposal, but this need your joint efforts, and then put that as a question to the stakeholders, or even yourself could work on that. If we think about that, we can increase that. Let's see, we can use this air condition. Could you put that the temperature at 24 or 25? Have you done a research? How much that could save to our planet, and how much cost that can be saved to use that to support the vulnerable groups? That's just my question. We always put that 18, 20. I don't think that's necessary. Thank you.
Yeah, we have about a minute and a half left out.
Just a quick response to the latest question. I completely agree. In Singapore, we have a Go 25 campaign. So to set your thermostat at 25 and above, yeah, not below. Yeah, and ready to do with our net zero goals as well.
I love these snappy answers, the short ones. But yeah, I don't know if we have time for a question. I'm afraid we don't, but do use the coffee break to continue these conversations. But very quickly, I'm just going to pass it around the panel for just a one sentence. Yeah, hate to do this, but a one sentence top priority recommendation to move towards a more coordinated and effective regional response. Just like a one sentence.
Yeah, just
This is what we need.
yeah, I think collaboration. Yeah. One word.
I think we need to do a lot more. We are starting at a very low base in terms of our coordination.
It's your pragmatist.
If everyone care about human being or humanity, whatever you do, and you think about those people who are at risk, who are vulnerable, then you have to ask yourself, in your capacity or in your capability, what you can do for them. This issue is a huge issue, especially in a big city. We have the people who live under very lowest standard everywhere. We have the people live in the under the bridge, across the canal, across the road. We have those everywhere, and we have many slums in a big city, wherever in the place in the world, not only in Thailand only or in Southeast Asia. That if you think about them, and we have so many academia, we have so many PhD people in academic group, can we put the head together?
Maybe we need more of a brain's trust on this, open up a space where we can get more minds on the issue. But yeah, one sentence, Rachel, and then Alex to round this off.
Yeah, like I'm thinking heat health action plans are kind of coexisting of both like the top-down mechanisms that we need to like get everyone to respond quickly, but then also as practitioners, because we were talking about community and vulnerable situations quite a bit this panel, enabling like community to be able to respond, like doing that from the practitioner side. I'm thinking a lot more of this both top-down enabling and then grounds up work moving forward.
Thank you. And I would just leave us with the thought that, coordination can improve when it's anchored in real operational decision-making. And maybe a note of good news, we know that heat is highly forecastable. So I think that makes it one of the most preventable climate risks if we can get the right governance mechanisms in place.
Thank you. Thank you for those thoughts. And please join me in appreciating the panel speakers. Insights and thoughts. And we have tea outside. So
yes, we'll be taking a 15-minute coffee break now before we dive into discussions on sectoral-specific discussions on agriculture and children. So please do find the drinks and refreshments outside and join us back at 11:05. And in the meantime, may I have all the speakers and organizers gathered to the front for a group photo. Thank you. Welcome back to the second half of this side meeting, co-creating a strategy and framework to protect and prepare communities of Southeast Asia from the impacts of extreme heat. We started off the morning framing the heat challenge and opportunities for heat governance in Southeast Asia. And in this second half, we will dive into two sectoral discussions on agriculture and children to further discuss the stressors and solutions of heat impacts in each area. So without further ado, please let me welcome up our panel speakers for this session. For this moderated panel discussion on stressors and solutions of heat impacts on agriculture. We have Ms. Catherine Jones, who has over 15 years of experience working at the intersection of climate change, food security, and livelihoods, spanning both humanitarian and development contexts, currently leading the Disaster Resilience Unit at FAO with a regional focus on Asia Pacific from Iran to Samoa. We welcome Dr. Yuka Yujita, Senior Occupational Safety and Health Specialist at the ILO Decent Work Technical Support Team for East and Southeast Asia and the Pacific, where she has contributed to improvement and promotion of safety and health at work through policy, technical advice, and training, particularly covering OSH data, safety and health of vulnerable groups, such as females, young workers, migrant workers, and those in the informal economy. And we also welcome up Dr. Orapan Antamanon, advisor to the Division of Occupational and Environmental Diseases at the Ministry of Public Health Thailand, where she has extensive experience in epidemiology, occupational health services, surveillance programs, risk assessment, risk management in both workplace and informal worker settings. Dr. Jaya, please take it away.
Thanks, Janice, and a very warm welcome to our esteemed panelists who bring a lot of wisdom and experience from the field into the room. And we're going to spend the next few minutes thinking more deeply about the impacts of heat on our food producers, the farmers, the impact of heat on crops and livestock. We're also going to weave in gender perspectives and look at policy interventions and solutions. So let me start off with the first sort of a theme, which is just in a nutshell, could you summarize the top impacts of heat on agriculture and food systems and workers' productivity and health, and what's currently being done by funders, by ministries, by frontline responders such as NGOs and so on. But let me start with Catherine. And I do believe you have a slide to sort of summarize some of the data that you have. Yeah, over to you.
Thanks so much. Yeah, and hi everyone. Good morning. So today I'm just going to touch upon, and I'm sorry that I have some depressing statistics to kick us off with. I'd like to start on a more happy note, but I think it's really important to lay down why agriculture is important when we're looking at heat waves and heat stress. So one of the key statistics that's been coming out of a recent FAO and WMO report on heat waves and its impact in the agricultural sector is that agricultural workers are 35 times more likely to die from occupational heat exposure than other workers in other sectors. That's huge. There's a huge risk when it comes to people being out in the fields. And when we think about agricultural workers as well, I just want to extend your mind not only to those working in the rice fields or in maize fields. Think about the fishers, the foresters, those who are also working with livestock. So it just goes beyond those who are getting the crops. Yes, they are very much exposed. And I think a lot of the time in our mind when we picture what agriculture looks like. But agriculture is very diverse across Southeast Asia as well. And this particular statistic encompasses all those workers. And what we've been seeing as well, the data is very, I would say, patchy at the moment. This is a very, I would say, up and coming risk, particularly for the sector that we've seen, particularly in the last 30 years, but really come to a fold in the last 5, I would say, where we're starting to see some key elements come through. One of those being is for every 1 degree increase in temperature, we see major staple crop yields, particularly in Southeast Asia, so rice, maize, in particular wheat, can decline up to 5 to 10%. That is huge, 1 degree, okay? When we're looking at extreme heat waves, and particularly for the marine sector as well, fishery losses are 4 times greater and happen much faster than impacts of gradual ocean warming. And then finally, when we're looking at livestock, and this is what I found really interesting as well, but one of the areas I think there's the least amount of data and evidence to date, but we're starting to see that 4 to 5 degrees can reduce fertility, milk yields in particular for larger animals, so cattle and buffalo, which are important for not only providing milk and meat, but also for supporting these agricultural workers out in the field to plough. So it's been really stark, I think, over the past 5 years. We know more information needs to come to light, but the information is there and starting to kind of spark us off saying, this is an issue, this is something we really need to look into. ASEAN has also ranked it as one of the top 3 climate hazards that is growing concern for them over the next few years. So we need to start prioritizing it with ASEAN and with governments. There are of course, we've been talking about heatwave heatwave action plans and areas like that. And of course, there's anticipatory action plans and frameworks. So I also co-lead the technical working group on anticipatory action for Asia Pacific. In 2025, we have over 250 frameworks available. Only 10 of those are for heat waves, all urban, all still under development, and very few activations. So we're seeing a massive gap when it comes to operability of being able to predict but also act on these particular risks. And then I would say as well, when we're looking at governance, which I think was really highlighted and captured well in the last panel, but agriculture is significantly, I think, not given enough attention in this space because the data's not there. So I don't blame people, but we are starting to see the bubble up signs. So it's time to act and see how we can really integrate this into planning and processes to get more action on the ground. So sorry to come with some grave statistics, but shows how important this topic is, I think, to kick us off today.
Oh, absolutely. And I was just something that came to mind immediately was, government's rise and fall, with hunger riots being, sort of a push factor. And that's happened even in recent times. I don't think that policymakers or decision makers are essentially making that connection between heat and food security. And that needs to really come to the foreground with better data collection. But how much data do we need? What's that sweet spot? How much more information do we really need before policymakers say, okay, I'm going to act? So to help us move along in that direction, I think maybe zoom back from the Southeast Asia region and get a broader global perspective from Dr. Yuka's considerable decades of experience in the area.
Thank you very much. The Kathleen just showed us the impact of the heat to agriculture itself. And I'm coming from the ILO. And of course, as you know, the ILO is a specialized agency on world of work. And actually, it's beyond the health and safety. And now I like to share a little bit about what is the impact, because our aim is the decent work for all. And actually, the heat impact the decent work, the deficiency of the decent work in many aspects. One of the aspects is not only health and safety, but also the productivity and the business. So again, we don't have the statistics, but this is the estimation of our research. And this is our research regarding the impact of heat to the productivity. In this case, we picked up one indicator, that is the working hour. Because due to the heat, we need to adjust our work. Actually, in the morning session, the agricultural workers said they need to shift their working hours from the early morning and the late afternoon. So that means the heat lose the working time. That means the equivalent to the loss of the full-time job. So you can see this is the estimation, and our region, Southeast Asia, is the third. It's maybe the 37% of the productivity will decrease. And then it's too early, but actually no, it's the back, please. Yes, and actually by sector, the agriculture is a little bit difficult to see, but the red zone is the agriculture. They followed by construction and service, but the agriculture is the most hit sector by loss of the productivity. Next slide, please. And then now go to the impact to the health of the workers. That is again, ILO's estimation, that globally 2.4 billion workers exposed to the extreme heat. Then click one. The result to the 23 million non-fatal injuries every year, and also 20,000 deaths at work due to heat. That is, of course, the estimation, but it's very close to the reality. But they think about the agricultural workers, especially outdoor workers. Of course, we should not forget about indoor workers, our colleagues said this morning. But when the workers work outdoor, they have the multiple hazards they expose, not only heat, but associated with the heat. Click one, please. Yes, this is the so many factors, hazards associated with the heat exposure. That is the one is the solar UV radiation. This is also the ILO's estimation, and also due to the increased heat, vector-borne disease increase, and also air pollution. And right now in Thailand and this area is very much affected by air pollution. This is a seasonal. But actually, air pollution level is increasing year and year. And also, due to climate change, the use of agrochemicals increasing, no? Because the natural disaster or any other reason, the soil is not very suitable for the agriculture. Then, to maintain the productivity, farmers need to use more pesticide, more agrochemicals. Then they exposed to the chemical increase. So these are the impact, especially for the health and safety of the workers in agriculture.
Thank you, Dr. Yuka. So, I don't want to keep using the word wicked problem or complex because that's so paralyzing. But it's clear that the intersections are evident and there's sufficient data. I mean, this should get people thinking and moving if this data can be flagged up to policymakers in effective ways. But going from a Southeast Asian and a global perspective and zooming down into Thailand, Dr. Orapan, you've had years of experience and looking at this issue. And what has Thailand been doing? How has the public health system been responding? What do you think are the gaps? And what kinds of data have you been successful in pulling together to help bridge this policy communication gap?
Thailand had approximately around 40 million employed person. Among these, you can see that around more than 50% are informal worker. And of informal worker, most of proportion are in work in agricultural setting. In Thailand, we categorize for agricultural setting into 5 groups. The main is the farmer and livestock, fishing worker, agriculture food production, and forestry worker. And most of them, you can see that they have to work in outdoor setting, that they have to face with heat maybe all time. Especially during summer season in Thailand, between this month, maybe the end of this month to June or May. That is when you see the heat index, you can see that no need to read, but you see only color. You can see that when you compare with February, we have the heat index data from the meteorological department, and we try to calculate. You can see that when we compare February with March and April, you can see that in February, you can see like a green color, but in March and April, most of the Thailand are in extreme danger and also in red color and orange color. This is just to take a look, take a look. When the heat index data show that, so the important is how we take care the agricultural worker. So because I am a representative of Ministry of Public Health, so today I talk to the occupational health services that we conducted by Ministry of Public Health and also other agency, but main is Ministry of Public Health. The occupational health services include like you have to walk to survey, you have to perform risk assessment, you have to perform or conduct give disease diagnosis and rehabilitation. And you can see that under the network of Ministry of Public Health, we have the provincial hospital, we have community hospital, and the large proportion of health service provider are primary care unit. These primary care unit right now, around 40%, they have been decentralized to local authority. So actually, right now, not a number of 10,000, but around 6,000 are still under Ministry of Public Health, but 40% have been decentralized to local authority. This is we have to get capacity building for the healthcare personnel. Yeah. So the gap of this occupational health service delivery, we found that they have to export to heat, but the occupational service coverage maybe not cover all of worker. So mainly because primary care unit, they have to work with the community and particularly for the informal worker, but they did not have the knowledge enough to perform the risk assessment or other. And this is the data. Maybe the next section we will talk the limitation of data. Thank you.
Yes, so what really is the limitation of data? One of the things I sort of always have trouble, like many of my colleagues in the media have trouble, how much do you need to really act? Can't there be small responses that one can learn and build on, like a snowball, rather than waiting for how much data is really needed for the government to act? So I'll turn it over to you to talk about the limitations of data, and just a gentle request to all the panelists to keep your observations short because we're on a tight timeline.
Yeah. You can see that this I think Thailand, we have the health data center system that we have like the unit data that from heat. So because we have like two platform. The first platform for health data center, we have to like the passive surveillance that the primary healthcare or healthcare provider have to send and give diagnosis and send the report to the health data center. Then you can see that the first one, the trend of heat related. The first one is occupational heat related disease. Did we mention occupational health? Did it for the unit data. Right now the trend is rising, but last year maybe is a little bit slightly decreased. So you can see the occupation. The first occupation that have the high rate of occupational disease is the farmer. And for the lower bar chart, this is the data. The data we cannot identify is from occupational health, from work or not from work. This is the mix of the dead case, is maybe from the underlying disease or from other. But you can see that in this, the first one, the high end number is we can like unknown occupation. Yeah, maybe you have to in the house and you find you dead already or something like that. But the second, followed by this, is the also work in agriculture. It means that the data just show the occupation that have to face the disease and also death is are in agriculture setting. And the limitation because the doctor have to take the diagnosis. This is we have the underreport. Even we have the platform, but we have underreport of this data. Right now we try to strengthen the diagnosis system. Thank you.
Thank you, Dr. Orapan. So it looks like there could be small changes, such as recording the occupation of the person who comes into the OP or the for inpatient admission, but whether they're a farmer or not. Maybe it's just a simple question about how many hours of sun exposure do you, just two little questions to fill in on an OP chit. We're serious about this, but more on that later. But so how I think the issue is really making the plight, the impacts of heat stress on informal and formal agricultural workers visible. So how do we go about visibilizing this in as short and as effective a way as possible? So over to you, Dr. Yuka. What are your thoughts on this? And then to Catherine.
All right. Yes, it's actually the agriculture workers and the informal workers are invisible because very often they are outside the scope of the protection by law or the policy framework. So that is the reality in many countries in this region. And also another issue is of course the lack of the resource, lack of knowledge, lack of capacity in the worker side. And actually it is difficult, but these the two issue is the top down and the bottom up approach should be very necessary. Actually, Rachel this morning she emphasized the importance of the engagement of the community, but actually it is the true. It's the both way, two-way approach should be very important, I think.
Yeah, just to quickly complement that as well, we've been doing some work across the ASEAN region, and it's really also understanding the impacts across different marginalized groups as well. So we say informal workers, but that's a lot of people in that kind of group and informal workers as well. So for instance, in Timor-Leste, particularly women were the ones who go fetch water for livestock, and they usually had to go around 2 kilometers to find water. Bringing that reserve closer by 20 meters significantly reduced heat wave stress and drought and heat altogether, making them feel just safer because a lot of them were fainting, going back and forth to continuously getting the water for the livestock. It also shows that it's a wash and an agricultural issue as well, that cross-sectoral element. In Vietnam, this one I didn't even think of as well when I was talking with farmers there, and we were doing anticipatory support ahead of a drought, but then a heat wave happened at the same time. And we're like, oh, why aren't we, going out and restoring the irrigation support, clearing the canals? And they're like, oh no, during, our time of month, it's hard for us to go out because we don't feel clean. So it's something that, we need to think about personal hygiene as well as the farming aspect too. So women were less likely to go out and to do their job. And then when we're looking as well as from farm to table, there's also street vendors who are also connected to this as well in urban areas, who are going back and forth to the markets and collecting their food and having to be out in the hot sun. And then sometimes with urban planning, that's not taken into consideration. And then they reduce their hours, and then that reduces income as well at the same time. So it's also working across urban sectors and understanding that cross-sectionality between these different areas. So it's really working together to understand the issues that we're facing across different marginalized communities. And it's not just one factor that I've been seeing, it's multifactored like everything, but particularly with the heat waves as well. And I just want to compliment Dr. Yuka as well with the working through social protection or farmer registries, for instance, to help document informal workers and ensuring that we can support governments to know who they are and where they are and have the right information. For instance, in Timor-Leste, we're working on developing the first farmer registry for the country at the moment. And as you're saying, small, sharp tweaks to that registry could help us ensure that we know if a heat wave is forecasted, we can pull up that registry and know who's the most at risk by overlaying important climate exposure, risk, and vulnerability data at the same time.
Thanks, Catherine. I think we have about 8 minutes or so left, so we'll come back to this, but what are some of the concrete examples of effective heat response measures in agriculture that you're aware of that can be scaled up? And I'll maybe start with Catherine and move on to Dr. Oropan and then to Dr. Yuka. So maybe Catherine, go first. What are some examples that you can think of?
Sure thing. I'll be quick because I feel like this morning we also touched upon some of these areas, so I don't want to repeat. But one is getting really good loss and damage information. This is so important. I know we talked about data and how much data is too much data and can we act on certain things. But the more that we can get and we set up systems to be successful for capturing these impacts with governments, the more we're going to be able to do. So it's getting gender segregated data at the same time, understanding people with disabilities who are also active formal and informal workers in the agricultural sector as well, really understanding impact. That's what we need to do. No, there's currently, when we're looking at loss and damage information, it's mainly drought. So it's looking at the long term, not that short term. So this is where the fund for loss and damage could potentially come through, working with other climate finance as well to see how we can start to build these systems. There are damage and loss agricultural impact tools that are available for heat waves, but being implemented now is the next step in ensuring that they're part of the fabric of government's work. Impact-based forecasting as well, I would also stress, or impact forecasting more so. Farmers need to know the economic impact that they're going to have on their livelihood to take action as well. So if we just say, oh, a heat wave's coming, do X, Y, and Z to protect yourself, some of them might be like, oh, okay, fine. But if you say, well, past heat waves have led to 20% of your crops being completely decimated, 10% of your livestock died, that has a bit more of an encouragement for people to take action as well. So really speaking the language of the farmers. And then my final aspect would be to really invest in anticipatory action as well. We have the ability, we have the tools, we have climate and weather information that is good enough to forecast these events. We know that investing in anticipatory action for every $1 can have a return of up to $7 in avoided losses and added benefits. So we could see that applied, I think, to heat waves and get our own return on investment, invest in more evidence is going to be really important.
Always come back to that heartless economic line argument, but over to Dr. Oraphan and
Yeah.
Yuka.
So one work that we work with ILO Thailand, we under the work plan of promoting a safe and healthy working environment, ILO collaborate with Ministry of Public Health and also Department of Labor Protection and Welfare. Firstly, we developed the questionnaire to ask to perform and conduct for the workplace. And right now, we developed the questionnaire and extend to the rider group. And I think for the third group, we will go to the agriculture setting. This is we get the information for policy driving, because in the past we didn't know how they get the awareness, how they know all the knowledge of the agriculture in the worker in agriculture setting. And the second one, we also work with close with ILO. This is for the media that right now, if you are interested, you can download with QR code. That is the media that we put right now. They put in ILO website. You can see that this is I think we have like a Thai language and also English language that you can use for raising the awareness of the worker who work exposed to the heat and also in agriculture setting. And right now, in our website or Department of Disease Control website, we also put it, and the number of download is quite high. Yeah, particularly in April and March, that they have to learn and get to know how they would like to protect themselves. Yeah, and for the future forwards, we think this the questionnaire that I talked before, we will extend to other settings. And because of the data limitation, so the strengthen the occupational disease screening and diagnosis is very important. And capacity building for health personnel and also for general population, not only worker, is also very important. That right now we have e-learning for this. And last one, that because we have the act that we call the heat-related disease, maybe in the next year we will put this disease in the Occupational and Environmental Disease Control Act to strengthen the legal recognition, reporting, and strengthen the surveillance system for occupational disease report and diagnosis.
It sounds like you're moving towards a legal framework as well, which, all steps in the right direction, I do believe, but hopefully faster over the coming months as the heat moves up. But over to you, Dr. Yuka, and maybe you could also end with saying, I know we're at the time.
Piece to go is the challenging of the last speaker.
Yes,
anyway,
please.
I like to emphasize the two-way approach. From the top down, the ILO has actually the convention specific occupational safety and health in agriculture convention. And unfortunately, many countries do not ratify yet, but also not only the convention, we have the code of practice, very practical, very detailed instruction guidance for the workplaces in agriculture. So we try to apply, assist the member states, government workers and the employers to apply these tools. And also the bottom up, thank you very much, all of panelists, they mentioned about the ILO's activity, but actually the ILO has the participatory action-oriented training materials very focused on the small-scale farmers. We call it WIND. And the WIN program is applied not only in this Asia, but also the other region as well. And that is very practical, action-oriented, but we need to engage not only workers or the farmers, but also employers, landowners, and also community leaders. That is the key. In many countries, usually the community leader play very important role. So we need to engage community leader and also public health facility. So we work together with the public health nurse and doctor to they are expert on prevention. Just add something on the work-related hazards and risks. And the heat is not only hazards the farmers exposed to, but we need to address multiple hazards at the same time. And for the decent work for all, we are working together. Thank you.
Thank you, Dr. Yuka. I think we just finished exactly on time, but I'm just going to ask for, I hate to put you on the spot, but a one-word answer. If someone had to take leadership to attend to this particular constituency, where do you think, what level of leadership do you think is required? Maybe at a regional level or a national level or a local level? You're welcome to respond to any one. Maybe just like a one-word answer.
To me, it's not the single organization, but I would suggest to establish the working group. Already the Bangkok has the working group and the Singapore has the working group. That everyone has their own role and they work together in each of the sector. That's my answer.
I would say that it needs to be vertical but bottom up. As our colleagues were mentioning, really focusing on community needs and wants and filtering that upwards towards making grounded policy and practice moving forward and financing to match what we need to see happen on the ground.
It's a very decent summary.
Carrying informal worker to get the higher quality of life because it's the large proportion, I think, in Thailand and also in global setting. Yeah.
Thank you so much. Thank you so much to our speakers. And now the floor is open for questions. I do believe we have about 8 minutes. Yeah, Janice has an announcement.
One question from the floor and one question from online.
Yeah, that's it. And I just very quickly wanted to also say that no one's brought up AI so far, artificial intelligence and how we can leverage technology, but we'll go very quickly.
Okay, it is very useful information. I'm Dr. Parit, an occupational medicine physician, and now I'm work as the advisor to the Ministry of Agriculture. As this is the response together with the question, the concrete example of nowadays, the stress and the solution of the heat impact. I think the three impact of the agriculture, firstly, the health, the work, and about their life. So I think the concrete solution or the example, firstly, in Thailand, we have one of the country that have the most number of pesticide law, but the enforcement, sometimes there is not a full 100% enforcement. Firstly, as you can see in the news last 2 weeks, the burning agriculture, the farmer, they was captured. That is the problem. Only
maybe this legal framework will address it, but if you do have a specific question for any of the panelists, we'd appreciate it.
Yes, with Dr. Orapan. So how we encourage the doctor or the many healthcare sector to report the system, because as my experience, sometimes they didn't know how and they didn't know why to report.
Thank you. And I'm going to invite one more question from Dr. Walter and also from, please come up. So we'll take these 3 questions. I think that's all we'll have time for.
Thank you so much. AI. To which extent do you feel that AI in general and pro-social AI in particular could actually serve as a catalyst for positive change? And where do you see the downsides of that? Thank you.
Yeah, anyone's welcome to take that when thinking about it.
Thank you for a great roundtable discussion. So my questions are also expand from the previous person. So building on the extent of how you apply artificial intelligence to this context, but how could you also include the village health volunteer and the work at the community level, especially for impact-based forecasting? Thank you.
Okay.
Yeah.
Okay.
The question, I think maybe 2 way. The first one is, I think is normal is for the communication and capacity building. Not only doctor, but the nurse who work in the healthcare provider, that they have to screening first and then refer the information to the doctor. This is the first one for capacity building. And the second one, because I talked earlier, that we decide his related disease into the control act. So I think law in enforcement is really important because this enforcement we will build up the strengthen of surveillance system. So this is the 2 way that we try to other disease earlier. That is okay. The number of diagnosis in occupational disease is right now is higher than the past, and we think heat-related occupational heat-related disease we perform the same model. Thank you.
Regarding the use of the AI, I like to very focus on the use of the AI in the rural sector or the agriculture setting in terms of the information. Actually, the not only AI, but also digitalization is useful. For example, the chatbot is very useful if the rural area cannot access or they cannot covered by the central protection. Sometimes that kind of information, instruction, very simple guide using the chatbot, it useful. However, at the same time, sometimes the information is false, or that is the very much, our concern, how we can control that information is correct or not correct. So that is another issue, but we need to use wisely that kind of digitalization and the new technology. Thank you.
I try not to go down a rabbit hole because I've been working on AI machine learning methods for improving forecasting systems at the moment. So it's not a one quick fix. I just want to say I love AI and I love what specifically machine learning is allowing us to do. So I've worked particularly with Papua New Guinea, Timor-Leste and Laos, for instance, on improving with the National Weather Services and meteorological services, their ability to run large data sets. So for instance, and I'll do my best to not go down the rabbit hole, but you have 30 years worth of data, for instance. There's a lot of information. There's gaps in that information. You can use machine learning, for instance, to find correlated methods between different data sets. And you can train Python, usually is the system that we use, to read them. So then it pulls up kind of trends and it allows us to understand more quickly where we can see potential heat waves could be coming, and we can understand from past events as well what the trends were, how much lead time we have, but it also allows us to clean up the models. So for instance, in Papua New Guinea, there's huge amounts of data gaps. So when we enter this data into the machine learning system and we train it, it recognizes those gaps and it can help fill them or place like a guess in there to allow us to understand better what could have happened and allow us to make better and more informed, accurate forecasts because so. So essentially with AI and machine learning, I see it as a really important tool for us to improve the accuracy of our forecasting models, but it also helps with human capacity because you're using a model. If you train someone on using Python and being able to read those systems, it actually makes things faster. So usually when we're calculating something, I remember doing a combined drought index in the past. for drought, of course, and it would take us maybe a week or so to come with a calculation. It was then moved into 10 minutes. So it's really that speed factor, but you do need humans to verify it. I would never trust it fully on its own. So when you need to pass that information through and then translate that, you need human intervention to come in. So it makes the forecasting side a lot easier, and you can match that with chatbots, of course, and other digital methods. But at the moment, I see its real power sitting with making forecasting more accurate and reliable. So that's where I would really invest in the coming years.
So the quandary of reconciling speed with accuracy and not knowing whether you're misled by AI. And of course, the trade-off is intense energy consumption by AI, which is a whole rabbit hole into by itself, which we don't want to dive into. But I do believe we have time for just one more question. And then we'll
Just
round it up.
follow up to Catherine. So on AI, reliability, accuracy, what about on cost factor? Does it going to reduce cost of program implementation and thus, burden share, less burden on resource mobilization, essentially?
I haven't seen that happen to date. I would love for that to be the way forward. I still think when it comes to agri-met services, you're still going to have to invest in weather stations. And what we need to do is make those information more automatized. So for instance, I was recently in Mongolia with the WMO team, and we did an assessment that allows us to understand the agricultural met architecture of the country. A lot of countries like Mongolia that's middle income, I would say still needs a vast amount of upgrades when it comes to their early warning mechanisms and systems. So I don't see AI as the solution to making it cheaper. It might in the long run, but for now we need to focus on automatization of weather stations, making sure that information is being sent to central levels. They're allowed to interpret it, allow us to understand it. It might reduce human capacity, which I think is not something of a cost-saving measure. It's an issue, and that's one of the remedies to the issues that we're facing at the moment. But yeah, I would still say you would need technology as it grows and gets more sophisticated. It's going to still take resources and time, unfortunately. But yeah, it will be just something to make us make better decisions. That's what I hope at the end. That will then hopefully save resources and lives. So at that side, I would say yes. But on the infrastructural side, I would say we're still learning, but hopefully one day.
It sounds like we need, together with heat governance, we need AI governance as well. And so there's lots of scholars thinking about it. So Cornelia, Dr. Walter is one of them. So thank you so much to our panelists. That was brilliant. And as I listen to the panelists, this is just like a sort of a starting platform for an initial series of conversations, and hopefully we'll build on these. So thank you so much.
Thank you again to the agriculture panelists. May I please welcome the panel speakers for our next and final session, the moderated panel discussion, Stressors and Solutions of Heat Impacts on Children. We have Dr. James Malcolm, who's a theme lead for maternal and child health at the University of Sydney. His research spans the lifespan, particularly expertise in pediatric occupational heat stress and protecting vulnerable populations during physical exertion. Dr. Basil Rodriguez is a regional health advisor at the UNICEF East Asia and Pacific, where he has served in several capacities with UNICEF, strengthening primary health care at community level and serving in senior capacities across nutrition, immunization, emerging infectious diseases across the regions. And last but not least, Dr. Professor Suripong Vacharasintu, who is widely recognized for his leadership in child and adolescent health, particularly in pediatric endocrinology, nutrition, health promotion, playing important roles in national health policy and research translation to improve child health in Thailand. Jaya, please take it away.
Thank you so much, and thank you so much for bringing your experience and expertise to this panel discussion, really important one, focusing on the future of the human race, on children and climate change. And could you very briefly in this first round just summarize the key impacts of heat stress on children, like really quickly, so that we can get into that very interesting debate about school closures that's coming up around the corner? That's a spoiler. But over to maybe James first, and then over to Dr. Suripong, and then Dr. Lisa.
Okay, good afternoon, everybody. James Smallcombe from the University of Sydney, Heat and Health Research Centre. At our research centre, I'm a physiologist by trade, so I'm interested in the impacts on the human body of heat stress exposure, particularly during pregnancy and childhood. And we take a life course approach to our research. We want to understand the impacts across the lifespan, understand the problems, but crucially offer solutions to these problems. So this is a bit of a cliche, but I think it's important to remember that children aren't just mini adults. They're very unique. They're going through a stage of rapid development, whether it be physiologically, behaviorally, and also socially. So the situation is very unique, and the impacts of heat on this population are also unique, which means that the solutions that we offer also have to be tailored to this specific population. Now, given this developmental stage, heat can serve as a barrier to children's daily activities, whether it be at school, at home, their ability to live, learn, and play. So the impacts can be quite profound and also very diverse. And really, I think when we consider heat as a problem for this population, we need to focus on this issue of livability. In a warming world, we need our children to be able to go about their daily activities optimally to ensure that their lives are disrupted to the least possible extent, so they can live a healthy, active childhood, which should set them up for a healthy adulthood.
Right. Okay. Thank you. So I think I'm going to say on behalf of pediatricians. So I'm working in the university hospital. It maybe not represent the pediatricians working in the rural area. But from my experience, I think about more than 30 years that I take care of children, I have to say that I haven't seen any severe cases of heat effect on let's say in the term of the heat stroke. Right, in the capital of Thailand, even we live in the very, very hot or very warm country. However, we could see some effect of the heat on the child health related to the indirect effect. Let's say, for example, they might cause the exacerbation of some chronic diseases. For example, the skin heat rash or skin reaction, as you know, that atopic dermatitis. And we could see in some situations, for example, we might see the infectious diseases, especially the diarrhea due to the bacterial infection. Right. So I think it is all the indirect effect that we have seen in Thailand, especially in Bangkok. However, we have some reported from Department of Disease Control, Ministry of Public Health, and they report in 2023 that there were 10 cases of illness. The age range between 13 to 75 and 37 deaths. The age between 17 to 81 is related to the extreme heat. But we don't know in detail what caused the death and what kind of the diseases that have been affected. The highest number is occur during the summertime, that means during the April. So the one thing that I come across about let's say the mortality or morbidity is happened in the military camp or military training camp. Regarding to the mental and cognition, I think you know that I have been working and studying in the Thailand for a long time, and you know that in the summertime we don't want to work, we don't want to study because we cannot get the concentration on any subject that we study. So you know that the temperature or the heat can affect in terms of the concentration or cognitions. I tried to find out the study from Thailand. I haven't seen that paper. Focusing on that things in Thailand, but I pick up some paper from Singapore, and this suggests that the cognitive performance might decrease from 9 to 18% when you face with the warm weather. The last thing that I can show you about the slide up there, actually is the global environmental heat and cold exposure burden among children aged from 0 to 19. You might see that in the previous 30 years, the environmental exposure to heat or cold in terms of the morbidity, mortality, it seems to be declined in the previous 30 years. But you look at the previous 10 years, I think the prevalence and incidence is going to be up. This might be related to the climate change that everyone going to face with. So I have to stop at this point, and we have to think that in maybe next 5 or 10 years, you might see the high mortality and morbidity of the heat related to, so many conditions on health.
So no excuses for not having disaggregated data. There's a wealth of data available. I'm just going to ask Dr. Basil to touch upon briefly. This is tragic. It's staring us in the face, but what are the competing priorities for the region? And how should we, what's being done currently, and what's the current level of urgency or awareness about this issue?
Thank you. Priorities. The public health space, and this falls in the category of broader public health. Diseases is sort of pushing the envelope in terms of getting attention, right? Because we don't focus on prevention, we focus on action. The issues around heat has not risen to a level of priority for a number of reasons. It's been raised before about the issue of data. Data has been sort of has been absent to sort of drive the agenda to say that we should focus on whether the issues as it affects children or heat in general. I wanted to just quickly touch on a quick comparison between adults and children, because I think it's been raised already on some of these issues, but seven quick points comparing adults to children. There's a higher heat surface in terms of high heat production. It's around sort of greater body surface area to be impacted between adults and children. Lower levels of sweat production, poorer practice in terms of fluid replenishment, the issue of slower adjustment to changes in weather, protein modification, and looking specifically at extreme heat as affect sleep and so on and so forth. So when we talk about priorities, the question is, whose priority? So the role of government is sort of a big issue in terms of how you drive the agenda to determine what's priority and sort of where you put your resources. This comes down to what affects individuals, but also what ultimately affects economic impact, and then you get some attention in terms of where the focus should be.
Again, back to that heartless argument, but I was looking at media coverage over the last few years during the heat waves, and the single most popular sort of way of looking at this issue and understanding it, which has an immediate impact on audiences, is school closures. We saw that happening during COVID. And so what are the impacts of heat on child learning? In response, we saw some data from Dr. Sitipong's slide using the example from Singapore about the very significant impact on cognitive development, but education, interruption to education, particularly looking at school-age children, and what kinds of policy interventions and solutions do we need? What are the trade-offs? What if home is hotter than school? Doesn't it make sense to send them to school? Should schools be made into heat-responsive structures? What are all the things that we should be doing? And I'm just going to move from Dr. Basil, and then to James, and then to Dr. Sitipong.
The issue of, you've talked about already, UNICEF has been looking at not recommending issues around school closures, right? Because there is no value in terms of closing schools. The impact on children is actually quite significant. It's also about the issue of managing children outside of school settings. The challenge that we face is, as we deal with heat around, whether it's cities or at least even around sort of urban centers, what are the alternatives to sort of dealing with children in the event of issues around school closures? Some of those, and you've touched on a bit already, around having more facilities around sort of cooling centers. One of the other things that we're looking at is, how do we do a better job of forecasting issues around heat? So preparedness becomes a big issue in terms of, can individuals, can schools, can governments do better preparation in terms of forecasting when heat and issues around are going to affect children? I think that's where I think we should be looking at some of the impacts to deal with the issue around school closures.
Yeah, I think the point around preparedness is an excellent one. And And I think that marries up with the importance of education as well, educating the educators to better respond to the impacts of extreme heat, and thinking about our adaptive capacity, things that we can do at various levels to better prepare schools for the impacts of extreme heat. Now, these modifications could be at the building level, better designing schools to be cooler spaces, but also at the personal level. We know there's active cooling strategies that can be applied in the school setting to keep children comfortable and safe. So that's another opportunity for us to intervene. And there's really no excuse, I think, for schools to be closed. We have the tools and the resources to keep schools cool and safe, and that should be the priority, keeping kids in the classroom where they can learn and ultimately thrive.
Right, okay. For the school closure, I mean, if you look at the review at the literature or newspaper from Thailand, I think we haven't got any national policy to close the school during the, I mean, when you're facing with the heat problems. But anyway, it may be the good luck for Thailand because the school holiday or the time that school close is normally on the summertime as well. During the month between February, maybe March, May, or April or May, something like that. But anyway, we recommend that to change the mode of teaching, maybe such from in person or maybe online. And also, we also have the suggestion from the Office of the Basic Education Commission, or we call OBEC from Thailand, and they suggest about the 6 items. The first one that is suggested, we should suspend outdoor activities and also avoid exposure to the direct sunlight. That means you would not allow the child, I mean, to go outside to play sport, to play PE during the peak time of the heat, especially about midday 11 or 12 until 2 or 3 p.m. The second one, I think they ensure that we should have availability of sufficient and drinking water. We have the water around the school, and also very easy to reach out. And also the teacher have to allow students to, let's say, sip the water or drink the water every time that they like. The third thing that they recommend, we have to inspect the ventilation system, including the electric fan and air conditioning. You need to regularly inspect. You fit it, but you didn't check it. And when the time that you need is broken, it doesn't make any difference, right? So you have to regularly check the ventilation system in the room as well. The fourth thing that we recommend that we have to, let's say, the flexible program in terms of the learning modalities from in person to online. Or one thing that you need to flexible program, that means you might start school early in the morning. Let's say from school that normally start school at 9 to 4, let's say, for example, we probably start school early morning at 7 or 8 and end the school at the early, maybe 1 or 2 p.m., right? And also the one thing about the flexible of the uniform, you probably see that the uniform of the school student is, so some school is very, very thick and sometimes it's very tight. So we should allow the school to wear very loose uniform, t-shirt or cotton light color or something like that. And also we need to implement the strict safety measure to prevent the child living in the let's say the car or the car park. And also lastly, we should provide the student to know how to keep the contact and the number that they need the help in terms of emergency. And sometimes we need to train the teacher and student how to do the resuscitation as well. Right. Okay. This is all the 6 items that announced from OBEC from Thailand. Yep.
Thank you, Dr. Sutipong. I think we're doing really well on time. So I propose when we come to the theme of leadership to build an effective and sensitive heat response to mitigate the impacts of heat on children, who should be taking the lead is, of course, the obvious question. We've addressed that at the agriculture and looked at it extensively in the governance discussion as well. But are there examples of specific kinds of leadership that you've been able to document, recognize, or say, hey, that's a great way to sort of get momentum, to build momentum to help children combat the effects of heat stress? So maybe I'll start with Dr. Basil, and then we can also look at the concrete solutions and then move on to James to talk about adaptive capacities of schools that you started talking about. Yes. Please.
I'd like to make a distinction between sort of leadership and ownership, because I think we sometimes put these two, and they have very distinct roles. Ownership for us should be at the community level, right? In other words, where it matters most. Leadership is at various levels, but we believe that leadership should ultimately come from government. There's a role for civil society, there's a role for academia, there's a role for NGOs, there are roles for everyone. The question really is about coordination, not so much about leadership. But to lead also, you require the substantive data to say why an issue does matter. I'm going to go off topic slightly, just to pick up on something I sort of picked up yesterday. In 1918, in New York City, the law stated that every house must have heating. So every tenant should have heat. 180 years later, this week, there's a new law that says every tenant can demand air conditioning. And it's only, and the landlord should pay for air conditioning. I'm not saying that should happen, but I'm saying that the world is shifting, the world has changed. It's a recognition that heat and the issues around heat is actually quite important. Now, where leadership come from? It came from the grassroots, right? In other words, individuals began to sound the alarm that these are issues that had to be taken up. And they themselves can actually begin to push government towards things to happen. So leadership, I think, is at all levels, ownership at the community level, but ultimately governments must be the ones that leads for the population.
Any examples of leadership that have gotten huge regional movements going that you can think of? I mean, you have time to think about it, but if you want to respond immediately, please go ahead.
There's some work that's been done across the region, supported by the Korean government, KOICA, in looking at ways that maybe we can gather better evidence that would allow for setting examples for other countries then to adapt and to follow. This issue really is about, can we finance the areas that we believe are important for others? As we look across the region, and for us, it's East Asian Pacific that runs all the way up through the Pacific and back through Mongolia. We believe that there should be better country sharing, so South-South collaboration, sharing experiences, and so that leadership, again, comes from all of us. And so for UNICEF around children, it's taking the data that we do have and sharing that more widely, but also saying how we can adapt these at country level by working with governments.
Yeah, so on the topic of adaptive capacity, and I think I'm going to go from the perspective of science leadership here. I think it's our responsibility to provide the community with robust data that describes the problem, but as I also mentioned, offers solutions. So there's lots of work being done in labs around the world. Jason's lab is one of them. Our lab in Sydney is another, that work really hard to identify low-cost, sustainable cooling strategies that can be implemented in settings like schools. And I think it's our responsibility now to begin to translate some of that really robust evidence to make a difference in school settings. So an obvious and simple example is the use of electric fans. Lots of work has been done over the recent years to define the upper limits of electric fan efficacy. So how hot is too hot at the point in which fans are no longer effective. And we know the answer to that. And fans can be very effective in keeping us cool, even up to 40 degrees Celsius. So the WHO have recently revised their guidelines about that upper limit. And this is a good example of a cheap, low cost and sustainable intervention that can be implemented in schools to keep classrooms cool and students comfortable without this over-reliance on air conditioning. As we all know, that can be maladaptive and potentially counterproductive. So that's just one example of how we can begin to translate some of the evidence that's emerged from lab-based studies into field settings.
Sutipong, some concrete examples. I mean, you've shared concrete examples, but I specifically wanted you to also include perspectives from leadership from the health sector, from the pediatricians community, and how they are promoting community awareness and so on.
Yeah, I think on my view, maybe on my view, I represent the Thailand, maybe different from other country as well. So I think to make this thing move forward, I think we need to get the data, as many people said this morning. So we need to get the data from our country as well. And then if we have the data, we have to urge to the government, that means to the big policy of the government, that this thing is happened, it's a problem in our country. So we need to take action on that in terms of policy or maybe even the budget, let's say for electric fan or something like that into the school. And then the body that going to lead this thing should be the Ministry of Education, because school in Thailand is under the Ministry of Education. So to make up the policy to allow the school to do something more flexible, let's say the flexible program, flexible schedule time, or even the flexible for uniform, it should be launched from Ministry of Education. But for the technical things in terms of the health, that means how many water that they need to drink, how to arrange the availability of the water, drinking water, or how to set up the school in terms of the screen space or something like that. We need authority of the Ministry of Public Health and Ministry of Education and Public Health. They should work together. You cannot work in the silo, right? And then the end point is about the director of the school. I mean, if you have the policy from government, if you have the maybe framework or guideline from Ministry of Education or Ministry of Public Health, that means school can do an action, right? But one thing we need to educate the parents, educate the people, educate the student and teacher as well.
So how many pediatricians do you think are really making the connection between climate change and heat responses in children, and
right.
at least passing on that basic awareness that you need to pressure your MP or you need to sort of vote for leaders who are thinking about these issues? I'm just trying to connect the dots here because, as Dr. Basil was saying, you need ownership at the community level, and we've heard from previous panelists about a bottom-up approach that will put pressure to get the data collection, the policy evolution, and the responses and dollars moving. So are pediatricians talking about this? Are school teachers talking about it? I mean, we can't
Actually,
expect children to do it.
Okay, I think pediatricians, we work closely with the, family and also the school as well. So we all know the problem related to the maybe climate change. Even now that we don't have the big group of people taking care of this, but I'm sure that there is at least one group of them that they can to work in this area. And we have the Society of Pediatric Society, and we launch and we urge this problem into our society. And this thing can make up look like the connect with the policy maker to urge to the government as well. Right? It's possible.
And I also think we've got a real opportunity at the moment to bring the topic of heat and health into the school curriculum from the very early stages. So the heat health should be taught in primary schools. Children should be aware of the risks associated with extreme heat exposure. And by teaching students at very young ages about the dangers associated with heat, that information then also trickles back to the parents. It's fed up to the teachers, and then the community as a whole becomes more aware of the real threat that extreme heat poses. So at the University of Sydney, I'm actually trying to get a few initiatives off the ground to take heat health workshops into primary schools, secondary schools, to start kind of get the ball rolling on some of these educational initiatives. And I think there's a lot to be said for that potentially.
So ownership by young people, absolutely. Dr. Basil, you have thoughts on this?
We've started in UNICEF a bit of work called the Children's Environmental Health Collaborative. It's a platform that brings government in, bring young people in to be able to share experiences, and through that to amplify where investments need to take place. We've also did a study, I think was it last year. We looked at 3 countries, Bangladesh, India, and Indonesia, in trying to find out sort of what we call sort of social and community listening study. trying to at least hear from communities what the issues are that are relevant to them. And there are three quick points I'll make, key findings. Often the issue is normalized. It's a summer, so therefore it's okay. It's supposed to be hot. So don't normalize the issue if it's a real problem. And that the second is that it's actually under-communicated, right? So not enough is being shared for others to understand the magnitude of the problem, versus what we believe should be the desired state, which is recognizing that heat health there are hazards requiring preparedness. We mentioned that earlier. Another is looking at issues around pregnant women, caregivers, and the elderly. That cooling, hydration, and sort of schedule adjustments should be woven into the fabric of the way that we work and the way that we operate. And then finally, that issues around sort of heat action plans, heat alert systems, and sort of shaded cooling public spaces are things that at least we can ask young people to also amplify to bring back to families and so on.
Thank you. Thank you for flagging up maternal heat. The other thing I just quickly wanted to flag is it's not like we just can't firefight heat during the hot season, and this needs a year-round sort of a response. I mean, impacts on cognitive development is not something that just happened during summer, but it's like something that carries on over time. So how do we reconcile firefighting with a more concerted year-round kind of an approach to this problem? And that's one question. And the other thing is, because we have just a few minutes left, is there something really important that we haven't covered that you'd like to flag up?
I'll just take the second question. One thing that I think hasn't been brought up at all in this session today is the way that we portray the issue of extreme heat and the impacts on health. So from a media perspective, it's quite common for us to see on the TV or the newspapers during a heat wave photos or pictures of children happily playing at the beach, in the sea. And it's portrayed as a kind of a glamorous event that can be enjoyed. And I think that's quite a dangerous path to take, because what it does is it diminishes or how serious the community takes the issue of extreme heat. And we should be portraying heat as the threat it is, a very serious one. And this glamorization of heat in the media, I think, is potentially very dangerous. And I was very pleased to see Gin launch their photo competition recently, I think for exactly this reason, to better tap into the portrayal of extreme heat. And I think it's especially important during childhood.
Right. I think I first of all, I would like to support James about the education, and you should put this topic into the curriculum during the school, even the young age as well, to know about the impact of heat on child health as well. So in terms of, let's say, announcement, make the people know about the impact of heat and child health. So it's very hard topic to do that. So even you advertise or something like that into the communities, but they don't accept that, and they don't see any example or any impact on their health or their family or something like that. It's very hard to do that. So the campaign is one thing that we should raise it up. And anyway, give some example of heat effect on the health is very, very mandatory. The one thing on Thailand, I'm not sure, maybe in Singapore as well, you might see the military training student, dead due to the heat problems. It's quite common in our country. Every year, I think at least 1 or 2 die from the heat stroke. So this thing we need to encourage the military camp to be careful of this, and any guideline or any precaution or any framework to take care of this thing as well.
Yes, yeah, it is a slow burn issue, pun intended, and it's just like the diabetes epidemic has crept up on the world with our shift to processed foods over a period of several years. No one saw it coming, but here we are with a huge problem today. But over to you, Dr. Basil, to wrap this up with
exactly half a second left. Some resources. We're trying to dig into sort of expanding materials to share with others in 3 quick areas. One is looking about trying to better understand the problem. A second is looking at guidance and solutions. And the third is looking at sort of national action that should take place. And the next slide, please. And we'll share the links with everyone. We're out of time, but just to say that this is an area I think that's under-resourced, underestimated, and lots of potential to at least impact positively on people's lives, save lives, asking to work collaboratively on this within this space. Thank you.
Thank you so much. The floor is now open for questions. I believe we have about 9.5 minutes. Please state your name and who you would like the question to be answered by. Yes, sir, please. We may have some online questions as well. Yeah.
Hi, everyone. Sorry, I'm Pamod, representing DHIS2 and the University of Oslo. So again, I have a data question. So in many countries, especially in low and middle income countries, when we talk about children and data, we have, the thing is, apart from surveys, we need routine information also to make decisions and to kind of think of an impact. But when we talk about data, children under 5 years of age, we have really good routine data. But once above 5 years of age and adolescent, we don't really have that kind of well-established routine systems. And in many countries, school information systems are not connected to health systems. So again, when you try to connect climate data with health data to kind of assess how heat is impacting children, has it been a challenge you have encountered? And if so, are there any learnings from countries how they have been able to overcome this issue?
Dr. Basil, and then maybe Dr. Satipa.
Maybe I can start. It's good to have someone from DHIS2 in the room to ask us some data questions. Look, it's really complex, right? Because you're talking about collecting data in clinical settings, collecting data in non-clinical settings, in school settings. The question is, how do you harmonize data, and how do you analyze data to make decisions? Much harder than simply saying that we should collect more data. We do realize that that's a problem. We started doing some work in sort of digital health across the Pacific. Very fundamentally, something as simple as birth registration meant that we didn't know how many people were around, right? So having a platform in which you at least can begin to at least have a denominator to work with. Second, maybe retrain clinicians about how to collect information in clinical settings and to recognize signs and symptoms. The question then is, what do you do with all this data? And then what does it impact in terms of making decisions? I think there's a whole body of work to be done there. And I'm glad that the data issue, to me, should be receiving a lot more attention than it is right now.
I think the data issue is the one thing that I said previously that is a weak point of our country as well. So I think I just listened from the previous panel, Dr. Orapan, right? I'm not sure she knows is there any data collection under the public health or not. But for the university, as my work, we don't have that data anymore. But I think the one thing that we have, let's say, the data is seem to be very fragmented. So it's not synchronized between, let's say, hospital, university, or maybe in the community or public health as well. So maybe someone from Thailand maybe show us about you have get any data?
Yeah, so your question was about kind of health impacts data, but I also think there's another interesting question about understanding the mechanisms behind the health impacts that we're observing. And I think more data is needed to better understand if these impacts of extreme heat are due to some kind of physiological difference between children and adults, or whether it's more of a behavioral issue. And the reason that's important is then that can then help inform the solutions that you might offer up. So it's a slightly different slant on a question of data.
That's a valuable point. And yes, we'll take question.
Yes, I think it's probably a little bit more of a comment thing, but Emanuel Kesmali, I'm from the Institute of Nutrition, Mahidol University. I also have some of the things to follow up on data. For Thailand, there are different data nationwide. We at the Institute work on National Food and Consumption Survey, also collaborate with Mixed Survey of UNICEF, and then we have National Health Exam Survey. Over the years, these are some of the things we cover from 6 months old to 80 years old. Now, those some of the things that we have, and I think Dr. Sutipong is right, it's very fragmented. And to find a collaboration, to try and jigsaw piece that into action and into policy is a challenge. The owner of data, lots of time, do have their own turf to report to. I think some of the thing about heat and health, particularly in children, could be there could be a coordination. This data is collected periodically. Lately, we are able to discuss with the National Health Exam Survey so we can collect the data from the same sampling frame to make sense. Maybe this would be an opportunity where we can do heat and then take a look at that. I think one of the issues that I'm interested in is that beyond school, the younger, what about infant and toddlers years? Are they vulnerable? What about fetus and pregnant women that are subject to heat? What happened to cognitive development? What happened to the things that they are doing? Nutrition-wise, there are something ongoing. We know that they are most vulnerable. On heat, we should add on to that and see what really has an impact, particularly in the area like in the South, where women clothe themselves heavily during pregnant and lactation. Thank you.
If you have questions, please.
Yeah, just a brief response. I think you're completely right about the importance of infants. They're certainly the most vulnerable population below the age of 5. They're most at risk due to a combination of physiological deficiencies, for example, impaired sweating capacity, but also behaviorally. They can't do much to tell us that they're struggling with the heat, but other than cry, or they can't make the appropriate decisions to protect themselves. So again, it's for that reason they're even more at risk. So I think that's an important point.
Yeah, I think your point is very interesting. I think James, you're a physiologist, you might know better than me. Right. Actually, I mean, not only infant or not only childhood, and also adolescent as well. I myself am endocrinologist. You know that why the population, I mean, the birth rate now is so to be declined in every country. Maybe heat is one factor that affect the level of the sex hormone as well. There's one study, they report that.
Yeah, I'm going to request the audience to be really crisp and short with your questions and directed to specific participants. Thank you. Cornelia, over to you.
I'm very short and very direct. AI. I'm coming back to my same question that I had before. To which extent do you think that AI in general and pro-social AI in particular can serve as a positive catalyst? Because considering the energy imprint and the consequences of that on the overall climate situation, it can be a Pandora's box. So I'm wondering what your thoughts are on that.
I will take Dr. Yoga as well, and then come back to
So I have quick 2 points. The first one is data. And I like to share the source of the data, possible source of data should be the workplace, because the employers are obligated to notify any hazards and risk and also the occupational disease to the authority. And not only employer, but also the workers themselves, as well as compensation insurance company. So that is, think about a potential source of the data. Second point is that they listen to their speakers. I'm thinking about the connection between the previous session and this session. Actually, the children is growing up, and maybe 10 years later, they get into the workplace. So if they already know the heat health very well in the school, maybe they can bring that knowledge and the skills to the workplace. So maybe we have to strengthen our coordination between the workplace and also school. That is my idea. Thank you.
Thank you so much. I think we are out of time, but I invite the audience to appreciate our speakers for sparing their time and wisdom. And also to flag that I hope, like what spurred the response to the COVID-19 pandemic with, news of several deaths in Italy, that's what started in a way. We don't have to be exposed to a possible future scenario where there's going to be horrific children's deaths. That's going to impel policymakers to act. So with that sober note, I leave us all just underscoring the urgency of the situation, hoping that we'll move quickly towards a regional response. We already have the GIN Global Regional Framework in place, and hopefully this is a good starting point to get those conversations moving. So thank you very much, and I'll hand over to Janice. Thanks once again.
Thank you very much. Thank you again to all the panelists. You may please take your seats. And now, as we're nearing the end of our time together, we have a period of closing reflections and commitments for next steps. May I invite Mr. Ben Churchill to provide these comments? He's the director of the WMO Regional Office for Asia and the Southwest Pacific, where he is responsible for ensuring national meteorological and hydrological services to deliver the best possible climate, weather, and water services to their communities and key sectors. Mr. Ben Churchill, please.
I'm just going to break with tradition a little bit. You probably expect me to go to the podium and have these prepared notes and so on, but I've actually found this to be a very interesting session. Thank you for the nice introduction. And I just want to thank Dr. Jaya for an excellent job moderating. So I think a special round of applause is due. And thank you, of course, to our speakers. Thank you to the organisers, to the GIN, to World Health Organization, Rockefeller Foundation for putting this together. And thank you all for coming from all over the region to bring your perspectives. I've found it very valuable. I've only got a few minutes and I know lunch is on the other side of this sort of closing remark. So I'm going to keep it pretty short. And I just want to sort of maybe, I'm not going to repeat all of the comments that were made, but some of the key sort of takeaways for me. I mean, we started with the context, the last 10, now 11 years, we're about to get the next sort of global state of climate report showing that 2025 was, the hottest. We heard it at COP, it's sort of been indicated. So we've had 11 years of warming trend. However, what we've heard is that heat isn't getting the attention it deserves. We heard from the Rockefeller Foundation that it has a very strong economic case. It's probably the strongest in the world. And we keep, Dr. Jaya, sorry to sort of bring this up, but you kept saying it's, it's a pretty heartless topic, but it's actually probably the most important topic that's we're not sort of addressing. Now, in terms of, where I come from, same as Ale, the World Meteorological Organization is focused on science for action. So it's about the climate data, the science, and how to translate that into action. So we've heard lots of very practical examples. So I think we have all the tools and we have all the people. So what we really want to explore next is how do we bring that all together? So some of the key words that really came out through all of the presentations, I think we've got a strong sense of commitment, but we need to recognize that it is cross-sectoral. We can no longer continue to work in the silos. That all we need to come together. Just sort of, I'm going to go back and forth a little bit because some of the key points were made at the very end. This concept of leadership versus ownership. I think that actually was a cross-cutting theme, if I can use that term again. We do have, the attention of governments. We have the attention of investors and so on. And we also have the people that are affected. And we have to kind of get that nexus between the leadership and the ownership. I think listening and talking to the communities that are affected and getting that information and finding out what they need to enable them to take action. So this is sort of linked, and I'm actually quite surprised. We've heard about anticipatory action. We've heard about impact-based forecasting. One of the key things that is the focus of not just the World Meteorological Organization, but our partners, UNDRR, ITU and IFRC, who are here, and also SCAP and many others, FAO, World Food Programme, early warnings for all. It's a brand. It's been developing over many, many years. They're all linked. And you actually can put all of what we've been discussing today in this context of understanding the risk, the vulnerability, the knowledge of that, getting the data, which is the WMO's role, observing, and we've heard comments about the gaps in the observation network. We want to automate as much as we can to collect that data in real time as much as possible. Sharing the data is key. Disseminating information, warnings. We have the ability. We have the technology, we have the networks to disseminate those that important life-saving information as quickly as possible. I want to commend, actually, this is just breaking news, that Thailand just announced a 99% coverage through their cell broadcast network for PM 2.5, but also heat is going to be coming on board. We're seeing more and more of this. We've got the capacity that's unfolding really quickly with technology. And finally, the response. So IFRC plays a very key role. We had Lieutenant General Belly here before, understanding the community needs and the response and what they need to help them. So I think maybe a takeaway, I'm just going to share some insights just to conclude. Ale, I'm not sort of being biased here, but he made a very good point earlier in terms of we shouldn't try to get the perfect solution to the problem. The problem is complex, it's dynamic, it's evolving. It's evolving, you know, the heat trends are increasing. But we can do good enough with what we have now. So I can't remember the exact phrase that perfection is the enemy of the good. I'm going to change a little bit to say that good enough is actually better than perfect, because it's something and it's forward progress. And of course, we can fine tune and adapt and so on. And the other thing, just to bring us back to a sort of a climate discussion, we haven't talked about mitigation. What we've talked about in this room is all adaptation. And I think actually that's where the world is at right now. Mitigation just seems a step too far, and we're pushing, and there are some positive trends with renewable energy and policies and national adaptation plans and so on. But more and more we have to focus on adaptation. And to do that, we need financing. And we're also seeing another global trend, which is concerning, that governments are pulling back their funding towards sort of humanitarian and climate and weather, quite honestly, and focusing more on national security, defense, so on. That's a geopolitical situation that is also evolving, but it's related. But what we're seeing coming in behind that is more philanthropic organizations. We're seeing the insurance sector stepping in. They're realizing that it's actually part of their sort of approach to improving the world we live in. We're also seeing lots of innovative solutions. I can't go through them all, but one that really grabbed my attention was the Rockefeller Foundation in Bangladesh. It seems to be a really practical thing. It was driven by an event. And this is what actually, dare I say it, we need those events. People do suffer through these sort of natural hazards and so on. And it's usually the big things, the big shocks that trigger the response. So we had COVID. So we've seen a lot of things improve in the health sector. We've learned a lot from that. It wasn't perfect in any way, but it helped us, you know, understand how we deal with that next time. We can do the same thing with heat. And I think there's enough people in this room doing the right thing. How we bring that together, the governance is absolutely key. Having the structures in place, we have the framework. We had a lot of positive feedback on the extreme heat risk governance framework and toolkit. It'd be good to see that rolled out and see some practical examples delivered at the local level. And the other thing I think I'll just finish off, because my time is running out and lunch is just around the corner, is the local context. So going back to Jason's comment, knowledge is king, context is queen. I kind of like that analogy, because we can have all the data we like. How much data is enough, got asked. Everyone's saying data, AI, you know, we've got the ability to collect data, and we should collect more, and we should analyze it and use it. But until we really understand what's happening on the ground, and we listen to the communities, to the families, to the children, and I'm a very strong advocate. I have a young daughter in school in Singapore. We live in Singapore. And her school is adapting by changing the way the children dress, changing the way they spend time outdoors. And we saw at the very beginning in that compelling video in Thailand with the community, the agricultural community, they were doing it themselves. They're making their own choices about when they work and so on. And of course, the risk is still there, but they're managing the risk. So my final message is how, it's like a question / message, but how do we take those examples and how do we scale them up? And how do we continue to work together to find the solutions? The solutions are there, and I think we can put all the pieces together. So I think my time is up. I really want to thank all of you, because this is all, you know, a reflection of the community that we work in. It's a very positive, hopeful, ambitious community. We all know what we need to do. Let's go and do it. Time is now. And I would like to thank you very much for the opportunity just to say a few words at the end. And again, thank you to the speakers. Very, very insightful, very informative, very helpful. And let's not just walk away from this conversation and go back to our desks and, you know, work in isolation. We are all in this together. And the more we can work together and make those connections. So at lunchtime, I encourage you to go up to somebody who spoke, talk to them, find out more about them, make those links, make those connections, form partnerships, form alliances, and keep doing what you're doing, because you're doing a great job. Thank you very much for the opportunity to wrap up.
Thank you very much, Ben. Thank you for your insightful comments. And so we thank you all once again for joining us this morning. If you may be interested to stay connected with the Southeast Asia Hub, you can also scan the QR code to stay in touch with our activities and events. And we do look forward to seeing you again. Won't stop you from doing lunch, because lunchtime is now. But I do hope that we all do take forward these conversations and move them to action. Thank you very much.